morning, everybody. I gained something that will look at be very common, but yesterday I was so happy. The issue of in those days, our chicken or pigs, all those things, after eating, everybody will go and wash our hands. Then we give the cattle, I mean the livestock to drink. And the speaker said, whatever that animal takes, it comes back to you. So in fact, even when I was going, I said, education every day you are gaining. So I'm so happy, and I thank God for the organizers. May God richly bless them in Jesus' name.
Thank you, ma. Please let's clap for her, ma. Let's clap for her. So everything you give back comes back. So if you think you are trying to favor someone, no, you are favoring yourself. You are trying to pull someone down. Know that you too you are coming what? You are coming down. So let us try, as she has said, that in everything you do, you have to watch, think before you do it. Washing your hands to give your livestock, it's not hygiene, it's not an ideal thing you should do. So you should look and think about it again. Please, another person again that wants us tell us one or two things he learned yesterday from this table. Yeah, pick one person. This table too. I want one person. This table, one person. This one person. This, you, yeah, madam, have rescued them from this table. So, okay, from this table too. Okay. Thank you, sir.
Good morning, all. Actually, me Ibrahim Alasa. That's my name. We talked about animal husbandry yesterday, where they told us that animal husbandry is the care, management, and breeding of domestic animals for production of food and fiber.
Let us clap for him, please. Any other person? Any other person? Who wants to say one or two things he learned yesterday from the presentation and discussions from this table?
Good morning, everyone. I learned yesterday that you want to feed your livestock. It's not just any quantity of food. There's a specific quantity of food you're supposed to feed the livestock and at a particular time. And if you notice any sign of sickness or whatever, livestock, you consult the veterinary to treat it as soon as possible. Because if that livestock is infected,
Very much self-medication to livestock is dangerous, both health and the animal. Thank you. Who are now say one or two things? So we now move to the recap. This table.
Good morning, everyone. I want to share a story. I learned that while training our livestock, we should be concerned about those chemicals that are going into our livestock because eventually it's coming back to our body. It will definitely have some residual effects. May not affect us now, but later it might affect us. So we should be concerned about them. Thank you.
Thank you very much. A round of applause for him. Now we move to the recap of yesterday. Secretariat. Where she's coming from. Round of applause for her, please. It's not easy to be in the secretariat.
yesterday, if we were hearing it for the first time, is a global issue. We indices on deaths it causes in the United States, and we know that because they have data. We have no idea death it causes here in Nigeria. You have situations where people fall ill with very basic, very basic illnesses, but you find out that they are resistant to some antimicrobial drugs. So we have to really take this home with us and inculcate all the good animal husbandry practices we learned yesterday. We shouldn't use antibiotics indiscriminately. Then the second paper was presented by Sir Chijoke Uchebu, a private practitioner on the effects of climate change on animal feed and fodder in Nigeria. So we all know we're not blind to climate change. I was opportune some months back to go on a survey, and I met our local Fulani pastoralist, and we were tasked with a questionnaire. We had a questionnaire asking them on climate change, and to my surprise, when I broke it down to them, they know. Everybody knows climate change is here. All we have to do now is to look at ways to mitigate climate change, because we all know what happened yesterday or day before yesterday in Maiduguri. There was flood. About 70% of Maiduguri was underwater. And these are all effects of climate change. And activities of farmers also contribute to climate change. We have deforestation, we have indiscriminate land use, indiscriminate fertilizer use, indiscriminate pesticide and herbicide use, which contributes to climate change. So thank you all for being here with us, and I wish us all fruitful deliberations today. Thank you.
Thank you, Ma. Thank you so much. Moderating that we have to break our lunch. Okay. Let us give her a round of applause. Capture everything that we did yesterday.
I just want to add to our voice. The vice president of All Farmers Association is with us, and he helped us to bring the team, the practicing farmers, and he spoke to us yesterday. Sorry about the oversight, sir. So we are excited, and we know that today will be better. I know people were already itching. What of the feed and fodder? Yes, the prof is here. What of the other one? They are all here with us. Moderator, over.
Hello. Okay. So you have become soul of the Danida. Sorry, sir. Part of. So now we'll be going for our tea break. Second table. Six. Okay. It's going on. We can to know more about you have learned and the experience you are going to return back home. So please start about it and get your mind for it. Our mind of today. What we will take back home. Thank you.
Hello, everyone. I think everybody has gotten breakfast, fully loaded to download to present to us. Am I speaking everybody's mind? Today,
So we'll be
Dr. for the first presentation. Please, so let us take our jotter to write one or two things to get laws about good morning everyone.
mic is not.
So my name is Ridwan Yahya. True? Okay, thank you. I work with the Nigeria Center for Disease Control as I used to be a medical doctor anyway. I used to work in the hospital and then later decided to run away from the hospital because I believe I will do more when I leave the hospital. I will save more lives. Ironically, you may not agree with me, but I know that I may be able to save more lives when I'm outside the hospital. Do you know the reason? Yes, because as a public health practitioner, in Nigeria you have more than 200 million patients to take care of. But in the hospital, you have maybe one patient in a day or two patients, three, and confined within the hospital environment. But as a public health practitioner, you do a lot of things to prevent spread of infections within, even within the farmlands. We do a lot of interventions, awareness creation, policy, regulations, guidelines. Guidelines that we develop for healthcare workers to use to manage patients are developed at that level of intervention. So maybe you will agree with me that I have more patients to manage, over 200, as a public health practitioner than a clinician. So the topic for discussion, because it's going to be a discussion rather than a presentation. So just get ready to help me respond to some of the questions I'm going to ask us. Please, can you project? So the topic is antimicrobial resistance in humans and the effect on and food security. What's the impact? What are the challenges? And then how do we work together to mitigate those challenges, to address them as a whole? So I have this background, the outline. The objectives of this presentation, what is the burden of antimicrobial resistance globally, and little information Nigeria. Then what are the drivers of antimicrobial resistance? Then we're going to talk about the impact of AMR on food security. Then what are the preventive measures that we need to take to prevent antimicrobial resistance from spreading in our farms, in our communities, in our healthcare facilities? We round it up with question and answers. Next slide, please. So, I'm aware that there are a lot of experts, veterinarians, healthcare workers in human health, and most importantly, farmers in this class or in this hall. Can somebody In your own terms, what do you understand by antimicrobial resistance? It must not be a definition, a standard definition, but what do you understand as a farmer? I'm sure we have antibiotics, right? On our poultry, on our, pet, on, our animals, the big animals. So what do you understand when we say antibiotic resistance, for example, not even antimicrobial resistance? Who can give me? Okay.
What we refer to antimicrobial resistance, it simply means an ability of a microorganism to resist antibiotic.
So what do you mean by that resist? What is it? To withstand, to subdue, to reduce. Somebody said reduce. Do you agree with reduce? So I think we've already defined what antimicrobial resistance in a simple terms. Organisms or pathogens or germs like bacteria, fungi, parasites, viruses develop certain mechanisms so that when you use drugs that are designed to kill them, those drugs will not be able to either kill them or it will not be able to prevent them from multiplying. So when they multiply, they become more infectious. And that is the work drugs, antibiotics do on germs, on infections. What they do is they prevent those pathogens, those infectious organisms from multiplying and then creating a favorable environment in the system, and then they will die. That is one mechanism. Or they will directly kill those organisms. So they can kill them or prevent them from multiplying and creating unfavorable environment for them, and they will die off naturally. So that is what, in a nutshell, antibiotics do, in our systems, in animals, in poultry that we use to treat infection. So inability of those drugs to kill or prevent organisms from multiplying is what is called antimicrobial resistance. Next slide. So what happens when we have antimicrobial resistance? There will be treatment failure. Drugs that you use to treat your animals, you treat yourself, or is being prescribed for you to use no longer work. So meaning there will be increased morbidity, mortality. There's chances that people or animals can die from infection because the drug that is supposed to kill and cure them is not longer effective. So with that, we're talking about animals, it's going to affect generally the food safety because there could be contamination of food that we eat or the food animals eat because of contamination. And then for the animals, if the animals are sick or they die, you have 1,000 cows or cattle, and then they start dying. They will be reduced in production, either in milk production, in meat production, and generally the population of the animals will be reduced, and economically the owner is going to be affected, and at large the community or the country. So there will be economic losses. When you lose animals that are infected with antimicrobial resistant pathogens, you can't treat them, and you cannot eat them because they are sick. At the end of the day, you lose those animals, and it affects you economically. Next slide. So the objective of this is to know what is antimicrobial resistance, what is the burden of antimicrobial resistance in our country and globally, and also to see what role do we play. I put authorities here, but you are an authority in your farms. So what role are you going to play as a farmer to mitigate antimicrobial resistance to prevent, emergence and spread of antimicrobial pathogen in your farm. Next slide. And to use an approach that we use as a country to address antimicrobial resistance, we call it a One Health approach. Who understands what a One Health approach is? I think it has been something that has been emerging, and we as farmers, as veterinarians, should at least have an idea what a One Health approach is. What is One Health approach? Any take? One Health. If we say we want to tackle antimicrobial resistance using the One Health approach, what do we mean? One. Naya health, lafia approach. You say One Health. One Health. Please, the previous slide. Let me show you. Maybe the previous slide. You can see it through One Health approach. The last bullet. Provide practical AMR mitigation strategies to ensure food safety and food security through the One Health approach. Okay. You get the 1,000.
So, One Health approach is just like a systemic way of addressing antimicrobial resistance in both animals, humans, and the environment.
So you have my 1,000. He collect. So it is whatever we're dealing with our animals. We should be conscious in your farm. You should be conscious of yourself as a human being, and the environment, and the animals. So you take care of yourself, you take care of the animals and the environment. Who can tell me how you would want to do that? Not even only antimicrobial resistance. How do you take care of yourself when interacting with animals? And how do you take care of the animals when interacting with them? And how do you take care of the environment where the animals are and where you also live as a human? How do you do that?
I think the first thing you need to do is to engage your PPE, personal protective equipment. You set up, okay, Dr. Areola Samuel. I'm an agriculturist, so I'm not a health. All right, thank you so much. First and foremost, you take care of your own prevention first by using all those PPE first. Then when you approach your farms, you put all the safety mechanisms also on ground. And then finally, after you have done that, you then employ other means as, medications, cleaning of the environment, and so on and so forth. That is...
Thank you very much. So you see, with that, your own farm, you have already deployed the One Health approach to preventing spread of infection to yourself. And if you are carrying an infectious pathogen, you will not transfer to the either poultry or to the animals. So you are protecting yourself from getting what the animals have that you don't know, and protecting the animals from giving them the infection that they don't have from you. And of course, after whatever you're doing, you clean the environment so that the animals can live healthier and it is not washed away into the environment and then contaminate our sources of water and feed. Thank you very much. Next slide. So what is the burden of AMR? This might not be very relevant to farmers, but it's important that we understand that AMR, antimicrobial resistance, is a very big public health threat. There was a study that was conducted in 2019, and this is the most recent global study that showed all regions, of the globe about the burden of AMR globally. So it was found that over 4 million people that died in 2019, they had antimicrobial resistant pathogen that was associated with their death. And in Nigeria, you can see what is our population, over 200. But from that study, it was found out that over 64,000 people that died in that year were directly affected by antimicrobial resistance. 64,000 in 2019. And over 200,000 had association with, that died that year, had associated infections that were antimicrobial resistant pathogen. So you can see the magnitude of antimicrobial resistance, but because we don't have enough data, we are not aware, a lot of people, even the healthcare workers, the farmers, the veterinarians are not much aware on what damages antimicrobial resistance is posing to our lives. A lot of things are not done the way they're supposed to be. Next slide, please. So what are the drivers? Please, previous slide. What do you think are the major causes of antimicrobial resistance? Any take? Why do they happen and what are the causes? The driver.
My name is Abdulazak. What I think is that indiscriminate use of antibiotics, it's also because most of the farmers nowadays, they used to just go there and buy antibiotics and administer it to poultry or livestock, and within that period when they are doing that treatment, and they will take that animals to market for people to buy and they just consume. So that effect will reside in their body and will cause, even if they take the antibiotic, it will not work on them because they use strong antibiotic in their body already.
Very much. Misuse of antibiotics, irrational use, inappropriate use of antibiotics is one of the major driver of antimicrobial resistance either in humans or in animals. What we're saying is that when you use antibiotic that you do not need, we have commensals, we have microorganisms that are living with us, right? So by the time you are using suboptimal doses, maybe through poultry, because if you give your animal antibiotic, that is what the veterinarians, I'm not a vet, but I know about something they call withdrawal period, isn't it? You need to observe withdrawal period before you're supposed to slaughter or consume the product of that from that animal or the animal itself, right? I don't know whether we observe, how many people observe withdrawal period before they take their poultry product to the farm or their animals to abattoirs for slaughter? How many days after giving them antibiotics do you eat or do you slaughter the animals? How many days? So this is very important. Okay, so the veterinarians in the house will help us with, maybe we would have a section where we're going to discuss how to observe that period so that you don't bombard people, your clients, with suboptimal doses of antibiotics that you use on your animals. Okay? Dr. Ndahi will help me maybe later after this presentation. Thank you. Next slide. Okay, these are the drivers, some of the drivers of antimicrobial resistance, misuse in plant, animals, and humans, especially those of us that use them for the purpose of what? Growth promotion. Some people just take certain antibiotics and give them to the animals because they want the animals to grow. This is is a bad practice, and of course, to my knowledge, NAFDAC has banned use of some of those very critically important antimicrobials for use as growth promoters in the country. So we should know the regulations in the country that guides the use of antibiotics. It's very important because by the time they start enforcing, they come to your farm for supervision, for inspection, and then when they find out that you are using some banned antibiotics or antimicrobials or any product, on animals, you are liable because you don't have any excuse that you don't know. It is on NAFDAC website. Please, let's visit NAFDAC website to see what are the regulations that are guiding the use of antimicrobials. Lack of awareness. I'm very sure there are a lot of people that are not aware, even among policy makers, among healthcare workers, among vets, among farmers, that do not even know what antimicrobial resistance is and how it's, developed and how it's spread. So this is one of the challenges. If somebody doesn't know what causes something, he is bound to be committing without knowing that he's doing the bad thing, right? Then poor access to clean water and wash facilities. Water sanitation and hygiene is very important, because if your animals are infected by antimicrobial resistant pathogen, and then you don't have enough water facility to clean the environment, to decontaminate, to do a lot of things, water is very important for cleaning. If you don't have that, there is chances that that infection can spread to the next animal, to the humans, and also spread into the community. We have regulations. We don't have adequate enforcement of those regulations. There's no oversight, because sometimes the staff that are supposed to do that activity are not enough, or they're not equipped, or they are not, encouraged to do that. So poor regulations, and with substandard drugs, because sometimes it's just as good as taking small doses when you're supposed to take a full dose. If a drug is substandard, when it's supposed to have 1 gram, and then you find out that when you analyze it's just 200 milligram, you are taking suboptimal doses of antimicrobials, and then you are spending a lot of money, it's not working, and at the end of the day, your animals will get sick, it will not produce more, or it will die from that infection. Next slide. So what are the impacts? What are the impact of AMR on food security? What is food security? Food security is, in a nutshell, is a state in which all people, everybody, whether rich, poor, downtrodden, physically challenged, everybody, children, have sufficient access to sufficient, safe, and nutritious food to meet their dietary needs and preferences for an active and healthy life. So this is food security. Everybody should have access. So do we have security in Nigeria? Are we secured? Is our food secured with this definition? But you are the food producers now, including you. Yes. So food security is a national, in a country, it should be a national priority. Everybody should have access to food, qualitative food that is sustainable. Not you have today, you cannot feed tomorrow. Or if you eat in the morning, you cannot eat in the night or in the evening. So if we have this, we don't meet the criteria for our food security. Okay, next slide. So these are the core components of food security. It has to be available. Food must be available. There must be a reliable and adequate supply of food through domestic production, imports, or food aids. So conditions, right? If you want to provide food aids, where there are crises, there is disaster, like what's happening in Maiduguri now, despite what's happening there, a serious government will ensure there is food security in that place. That's what it means by what? Food aid. They can also open our borders to supply them, because maybe the neighboring state do not have enough to supply. So you can open your borders, they have close to Chad, Cameroon, for them to be able to get food to eat at least. Okay? So it has to be available for everybody. Access. Individuals must have the resources, both financial and physical, to obtain appropriate food. Where there is no free food, then people should be empowered. Jobs should be created so that people can afford to eat. Food must be properly utilization. You would see, just like our country, I wouldn't want to mention, we have crude oil, but we are starving of fuel. We're starving of gas to use to cook, to use to move our vehicles. So this is just an example of poor utilization. We have all the resources, but we don't know how to maximize the resources to benefit from those resources, make the resources available, the byproduct of those resources available for us to use. When you go to the rural areas, you see them harvesting a lot of food products, yam, vegetable, cucumber, they have local chicken, that they bring to the market, eggs, beans. But you see there is a lot of malnutrition in those places. What could be the problem? It's lack of awareness. They don't know what food to eat, what food to give their children for them to grow well. But they will produce for you here in the city to sit down because you have the money to buy. You buy all the food, and your children will go to good school. They look good, they look healthy, and they are not malnourished. So starving in the presence of plenty is one area that the country, or as an organization, we need to work on. Let's educate people, on how to utilize the available food they have. So we need to educate people. When you provide it, is available, how do they utilize it? It's also a responsibility of government for us to achieve, full the criteria for the food security. People have to be aware on how to utilize, how to get food, and how to maximize the available they have for their own benefit. Next slide. You've gone back? Okay. So what is the food security situation in Nigeria? They said over 70% of Nigerians are engaged in one form of agricultural practices or the other. And they contribute significantly to the country's GDP, which is about 23%, although less than 2% of that GDP is from livestock, just less than 2%. And they said Nigeria's annual beef consumption is approximately 360,000 tons, which is half what West African region consumes. So you can see the amount of, beef, only beef, 360,000 tons. But look at our livestock population. Are we happy with the population? They said we have more than 58 million cattle. Even though, all these figures are rough figures, Africa, we lack, capacity to actually capture our data accurately. And this is because there are a lot of factors contributing to that. There are a lot of people that are not even captured in the population, the human population itself. So the animals they also wear are not captured. So a lot of data gaps, but even at that, they said we have over 60 million sheep, we have over 100 million goats. But these animals are consumed every day, so you cannot have the accurate or near accurate figure for animals that you usually eat. Unlike humans, if you have a birth and death register, you should be able to have accurate or near accurate population, unlike the animals as we're talking. Okay, next slide. So how do these antimicrobial pathogens spread into our food chain? Through fecal contamination of soil and water. What it means is that when we don't take care of our environment, especially our farms, there is likelihood that when it rains, those things might not wash into our immediate homes, but it goes into the environment. And people outside the community, within the community, can get affected, especially those that get their water sources from riverine areas. And of course, this contaminant can also affect crops because it can wash away into the farms where we have our crops, so we might end up getting some pathogens or antimicrobial residues from our plant sources. Meat contaminations, meat slaughter. Sometimes our animals might have had organisms in the gut. In the gut, you understand what the gut is, right? From the mouth to the intestine, to the stomach, and to the intestine. Maybe the meat might not be contaminated. But during slaughter, if you don't perform the necessary hygiene practices at the slaughterhouses, the meat that is not supposed to have organisms on them can be contaminated because it's not properly handled at the abattoirs. So this is also another area where farmers also need to pay attention to. When you slaughter your chicken in the farm to be cleaned and all that, so that what is not on the meat should not get on the meat in terms of germs. Direct contact with manuals, how we handle the manuals on the farm is also important, so that we don't consume when we do not observe proper hand hygiene. Environmental contamination and antibiotic resistance. I've already mentioned this. You know, when you use antimicrobials, especially sometimes when you use drugs that you buy, products, sometimes you buy some of these things and put in your store. At some point they get expired and you want to dispose. You just dispose them indiscriminately without considering the fact that there are antimicrobial agents in those things you are throwing away from your farms, and they can get into the environment and washed into our waterways. And also, pharmaceutical products. Pharmaceutical companies also, if there are no regulations, when they produce antimicrobials, the waste from the pharmaceutical companies can be washed into our waterways, and from that we can get suboptimal doses of antimicrobials, and it can be spread into the environment. Next slide. So what are the impacts of AMR on our food security? We have already mentioned some of these things. Reduction in animal and crop food production. Because we have already mentioned this, when the animal is sick, the productivity of that animal is reduced. If it is an animal that is used to harrow, like the bulls, if they are sick and infected with antimicrobial resistant pathogen, they won't be able to perform that work. Meaning, you are not going to have the expected yield in your farm. That's one. And then if the animals are sick and they're supposed to produce milk for you, they may not be able to produce enough for you. Okay? So there is a reduction in yield, productivity of the animals, whether for you as a human consumer or for the animals for their own activity. There will be compromised food safety, you know, as part of the impact. If our food, the sources of our food from the animals are contaminated, are always contaminated with a lot of antimicrobial residues, it means our food is no longer safe. So if we're talking about food security, we're also concerned about the safety of the food. If government has fulfilled all the criteria for food security, if the food is not safe, it is not enough. So food safety is one of the major challenges and impact of AMR on our food security. And there will be increased economic inequalities. If you look at the African region or the low and middle income countries, the burden of AMR is small, even though we don't even have enough data to prove that. You know, with the incessant or the traditional out-of-pocket due to poor insurance coverage, you go to the hospital, you have to bring the money out of your pocket. So if you are dealing with an antimicrobial resistant pathogen as a human being, you know, you are going to spend heavily. You have to do blood culture, you have to do this, you have to do a lot of things for you to be able to get treated, you know, get targeted treatment from the healthcare. So there will be, you'll be down, because if you don't have the money, you will not be able to. Then there will be increased poverty and hunger. When there is reduction in food production, definitely there will be reduced in food supply, and it can lead to increase in poverty and hunger. Next slide. What are the prevention strategies? What are prevention strategies? We need to promote responsible use of antimicrobials, enhance surveillance and monitoring. We need to improve on our data generation. But once there is a surveillance system, we should be able, even in your farm, when you have good people in your farm that observe very well, observation alone on which animal is sick, it's picked on time, it's treated on time, you will see that it's not going to spread among the remaining animals within the farm. So we have to generate data for action. Otherwise, if you don't know what is happening in your farm, not do anything until at the end of the day when you are expecting yield, you will not see what you have expected or you have estimated. We need to also strengthen collaboration. As farmers, our level of collaboration is that when you don't know how to manage certain disease in an animal, you need to collaborate, you need to consult professionals to guide you. Because if you don't do that, you might be harming yourself or harming the animals, and at the end of the day, you will not get the desired yield. We also need to invest in research and development. So that, because if people don't have anything to fall back to when they are sick, they tend to be using antibiotics. Cough and catarrh, antibiotics. Headache, antibiotics. If I fall down, somebody falls down, is limping, they will take antibiotics. Antibiotics is not a painkiller. It's not food. It's not alewa. Alewa or alawa. It's not sweet. It's not chewing gum. It's not everything that you take antibiotics. So please, we need to imbibe the culture of seeking advice for either ourselves or our animal. Next slide. No, the previous slide. Is that all? So I was talking about the research and development. What I mean by that is the government needs to invest in research in areas of producing new antimicrobials. If you look at it, it has been a very long time when new antimicrobials are developed. They've been what we have are old antimicrobials in circulation, and there is a lot of antimicrobial resistance, emerging from those drugs. Okay, and then we also need government to invest and private sectors to invest in producing alternatives, probiotics, something that is not antimicrobials, but you can use it in lieu of antimicrobials, alternatives to antimicrobials. We also need to invest in researches in diagnostics, because blood culture, for example, in human health is very, very expensive. For you to get an appropriate blood culture in a private hospital now, or even in some government hospital, you will pay nothing less than 50,000 to get a blood culture. Standard blood culture, not what they would say, okay, if you don't have money, we can do this. Standard blood culture, you will have to pay nothing less than 50,000. So if we can invest in a research that will make diagnostics very cheaper and affordable for everybody, they will solve a lot of problems. Because sometimes what discourages people from going to the hospital is those series of tests, and at the end of the day, you also have to buy drug. So if that is reduced through research, it is going to help a lot. Next slide. So how do we mitigate? So as a country, we have developed strategies to mitigate antimicrobial resistance, to reduce the burden of antimicrobial resistance. So we did some evaluation, because we need to do some situation analysis as a country, then do some evaluation, participate in some external evaluation mechanisms to know what is the actual status of Nigeria. Here we are not talking about Nigeria. What is the actual status of Nigeria with regards to antimicrobial resistance? So that's what we call the Joint External Evaluation for International Health Regulations, co-capacity. AMR is one of the thematic areas among the 19, as of them, 19 thematic areas for external evaluation. So you can see in 2017, we did our first JEE, and the score for the country was 39%. We did a midterm ourselves without the external evaluators in 2019, and we scored 46. When the external evaluators came last year, we moved from 39 to 54. However, if you look at AMR, they are up. We're supposed to have 5/5, but we only had 2/5. So that means we need to do more to make sure that antimicrobial resistance is contained in the country. Next slide. So I'm just giving you this so that you know that we did some evaluations to see where we are as a country before we can now start mitigating or tackling antimicrobial resistance. So with National Action Plan 1.0 in 2017, we implemented through to 2022. And after the implementation, and this national action is a One Health National Action Plan, meaning it was an integrated plan for human health, environment, and what? Animal health. So the implementation rate is at 44%. We didn't do well, you know. But if you look at antimicrobial stewardship, research and innovation, and awareness, after implementing from 2017 to 2022, it was still very poor. Only IPC, and this IPC biosecurity is also not very clear, because what took it most up is the IPC in the human health. Okay, so it's a bit biased. So if you look at everything there is red after implementing our first national action plan. So we now had to review, to evaluate, to see what is the reason, and we realize that there are a lot of things that are not very effective, like we did not integrate foodborne surveillance into our AMR strategy. So these things are now captured in our second national action plan 2.0. Next slide. Next slide. So this is the national AMR governance structure. We have what we call the Antimicrobial Resistance Coordination Committee, which is chaired by the DG of the Nigerian Center for Disease Control, co-chaired by the CVON. CVON is the Chief Veterinary Officer of Nigeria, and the Director of Environmental Health, like Director of Pollution Control and Environmental Health from the Ministry of Environment. So this is the One Health approach. Even at the governance structure, we are in the One Health approach. So we have the technical working groups, the soldiers that work across the sectors to ensure that antimicrobial resistance is contained. So tomorrow, if they ask you, do we have anything antimicrobial resistance containment strategy in Nigeria, is what? Is it a yes or no? We have. And it is very, very functional. Next slide. So this might be very relevant, but we have antimicrobial stewardship as a country. We have what we call the core element of antimicrobial stewardship. Antimicrobial stewardship means is a program that is supposed to be a national, subnational, or facility-based at any level, or a farm-based stewardship. What it means is you need to design something like a program, behavioral change program, that ensures rational use of antimicrobials. That's what it means. So even in your farm, you can design something and say, all your staff, before you use drugs for this poultry, in my farm, you have to do 1, 2, 3. And you have to monitor to make sure that they don't just give any dose to animals, right? So that is stewardship in simple terms. When you have something to guide a program and you follow up to ensure that those things are adhered to in your farm, you're doing stewardship. So for us as a country, we have a national stewardship program where we provide support to the state and to the facilities. And those core element is that we need to have a national action plan for us to be able to do that, which we have. We need to have some regulations, which we have. And that is the second core element. We need to have awareness and education program, which we have started, because we are yet to get there, but we have started doing a lot of awareness activity as a country. We need to have technology to support our data generation. As a country, we have developed what we call the antimicrobial information sharing system, where the animal health, the environment, the human health will be submitting their AMR data so that as a country we have a dashboard to say if there is this pathogen, we will now see if there is relationship in terms of transmission, trends among humans, animals, and environment, and so that we can take action at that level. Okay, next slide. So these are the core elements for us as a country. So there are core elements at the facility, or core element at the farm level, okay, that you can look at. What are those things that you need to have for you to be able to say, okay, you are observing antimicrobial stewardship program in your farm? You need to have commitment. There must be accountability. Somebody has to be accountable in your hospital. You must have something that you use to generate data, whether a form, a paper-based, or what, and you have to be reporting incidents. If you have incidents in your farm, it should be reported to to the appropriate authorities. Okay, as a country, for human health, sorry, I am a bit biased. We have like 52 hospitals that we are supporting on stewardship program. What we mean by stewardship, as I said, is a program that ensures rational use of antimicrobials in the hospitals by the clinicians, the pharmacists that dispense, the nurses that administer, the cleaners. They also need to be aware that their job is very important in preventing infection spread. So if the cleaners, you're doing everything and then your cleaners are not doing the right thing, there is tendency that infection will spread among patients that do not have infection. And it's going to take your treatment backward. Okay? Next slide. So for us as a country, we do surveillance system. We run a sentinel surveillance system. What do you understand by sentinel surveillance? In simple terms, is when you identify some places that you want them to do certain things and they'll be giving you information. Intentionally, this is what I want from your facility. You agree that you are going to key into it. Please, these are the things I want to do because we want to know what's happening in your farm. That is sentinel surveillance. You just pick, using certain criteria so that they can be submitting information across the country. So we run this sentinel surveillance system, and we also have an integrated surveillance that we're piloting, collecting samples from environment, from human, and from animals to see a common pathogen. We are looking for a common infectious pathogen, which is E. coli, one type of E. coli, ESBL E. coli. For those, this is hyperfalutin. We call it ESBL E. coli. We are now piloting to see if there is commonalities in terms of origin of those pathogens among humans, animals, and environment. Next slide. So with that, in animal health sector, we have one reference laboratory, which is the MVRI. And then we have 7, those sentinel sites that have been selected to provide that information. Next slide. So these are some of the key achievements as the mitigation strategies that we have in the country. All the things that we have been doing, these are some of the achievements. We have posted our national action plan and we're about to launch it. We are launching it this week or next week. It is not still certain. The environment, they now have an antimicrobial resistant policy. The environment sector in Nigeria, they have their policy. Even the animal health sector have validated their policy. And then they have treatment guidelines. So if you want a treatment guideline for your farm, for your animals in your farm, please meet the president of this alumni to link you with the appropriate authority in the Ministry of Agri to provide you with those guidelines. So we can support, if there is need, to see how we can translate them into the languages farmers can understand, those especially farmers at the grassroots, so that they know what to do. 1, 2, 3, these are the things that you need to do, to use when to antibiotic use in your farms, okay? So that is what we call surveillance system. So we also keyed into the global system of antimicrobial resistance surveillance data submission. Next slide. I think I've taken, is it time up? Okay, this is conclusion. We have a strong national One Health governance structure as a mitigation strategy for our country. We have strategies, 6 strategic objectives for containment of antimicrobial resistance. And you will agree with me that AMR surveillance and food system is a key priority for Nigeria based on what I mentioned, that we've identified that foodborne AMR was not captured in our first national action plan, but we have it now in our second national action plan. We need to increase awareness, funding, and research and development. So at your level, you need to start working on awareness creation. Whatever you know about this, you need to, I'm sure you interact with your fellow farmers, you have to pass this information to them. If you need more information, please reach out to the president of the alumni. We have a lot of information to provide to farmers that we're not able to reach. There are organized farmers, there are disorganized farmers. So if we're not able to reach the disorganized farmers, they should please try and reach out so that we can have their data and we can, whenever we have information, it will be shared for their use and to improve the productivity of their farms. Next slide. I think that's all. So, a question? No. previous, would you rather use antibiotics for consumption and without veterinary guidance, or seek professional advice and consultation before using antibiotics on your animals? Thank you very much. Thank you so much, Doctor, for the insight and impactful presentation. Doctor said we should give you 5 minutes, and he used 5 minutes. Abi, you used 5 minutes, Abi? Doctor, say you used 5 minutes, and you used 5 minutes. Say we should give you 5 minutes. Thank you so much. Let us give you a round of applause again, please. I hope you all enjoyed his presentation. Please, who have questions to ask him? 1, 2. Hey, Doctor, they really enjoy your presentation, no? See hands up, oh. Let me start from here. Yeah? 1, 2, 3, 4, 5, 6. 6. Okay. There's no 6.5 again, no? Or 6A or 6B. Number 1.
Good afternoon, all. I'm Lucky Onilo by name from Animal Care Diagnostic Laboratory in Abuja. My question is that during, I don't know if he's listening, speaking, okay. Dr. Sir, thank you so much for the presentation. I noticed that during your presentation, you were using antimicrobial resistance to be maybe using it interchangeably as antibacterial resistance. So I don't know if there are other, is antimicrobial all about antibacterial resistance? That's my question.
Number 2.
Good afternoon, all. Doctor, thank you for the presentations. Good afternoon to all. I'm Usman Nasiru. Doctor, thank you for these insights. So my question is, I just want to know the stance at Ministry of Health, the NCDC approach, knowing fully well that livestock holders in the country, 95% are the disorganized. Let me use the language you used. At the disorganized sector, only 5% that you may have control over that. What approach does this national action plan entails for us to achieve this antimicrobial resistance in the country? Thank you.
Okay, Doctor, thank you very much. Very, very insightful presentation. I have a question and a contribution. So my question is that how would you advise farms to dispose of expired drugs? Because I remember you mentioned it, and you mentioned the impact of such actions when they just dispose their drugs anyhow. And then my contribution is to food security, how you explained that AMR has a huge impact on food security. You mentioned the components. But there's one key component I think we should also talk about, which is food sustainability. So we need to ensure that our food systems are environmentally sustainable, they are socially equitable, and they are economically viable for our future generation. Thank you.
Number 4.
Thank you, Doctor. You've actually done justice to the topic. I want to ask this question on the issue of awareness. On the issue of awareness on AMR. I want to ask, how do we holistically do this using one health approach, considering what is happening here in Nigeria? If you even go to markets, people that are selling you will see one mallard beside the road. Check all, they are all antibiotics. Go to the man that is selling beans. You will see he or her spraying chemicals, the beans, that all of us will buy and eat. Besides, how do we control the use of pesticides on our farmland, where farmers just go, spray anyhow, even the use of fertilizer? So how do we do this awareness using One Health approach? Okay.
Thank you, sir. Number 5. Okay. Number 4, Abi.
Yeah, good afternoon, everybody. Edwin Akabweze is my name. I appreciate the presenter so much, has done a very wonderful work. My question is that, or my observation, this work is basically done as a research work without the inclusion of the farmers. The farmers don't know anything about what is being taught today unless they are here, just as we are here today, to listen to this very presentation. My question is, how will the farmers that are there in the field struggling benefit from this? Because most of this work are research works and are done to please the foreign donors or other people. Our farmers don't get these things down to them. They don't get it because when they feed, we have not seen extension, these veterinary people, moving to the farms to correct farmers to tell them what to do. Farmers keep on doing it the way they do it right from the time of immemorial. Where there is research here, spending millions of money, providing for these things, and they don't get the results. See now, the debt that is related to NR is even higher than the debt that is related to HIV/AIDS. Why shouldn't it? Because people have been eating the type of meat that have been eating a long time ago. They don't apply these things to their farms. So I pray and I hope that this organization, this Danida Fellowship Alumni, should try and make sure that this thing is extended to the farmers. We organize farmers here. We are not disorganized. If we empower the farmers that are here, they will extend this very teaching now down to the farmers in the village, and they will understand what is being done here. Otherwise, they will continue to do. How many veterinary hospitals do we have in Nigeria? How many of them goes to the veterinary hospital to know what their animals are suffering from? None. And they cannot get this in from conventional hospitals. So they should try much as possible to extend this teaching down to the farmers in the rural areas. Thank you.
Thank you so much. Okay, number 6.
Good afternoon, everyone. I would have said what I wanted to observe and contribute have been said, but I just want to say this because most times I will tell people that consumers are the detriment of farmers. Though the environment is not an excuse to know, but I must confess that if you don't know, you don't know. And what you don't know is more than you. What you don't know is more than. I was in a vehicle traveling to the States with Livestock, and she, from Abuja here to Benue, she was all giving her gist on how she's rearing her chicken, the type of fish she's using, and she disposes her chicken at 7 weeks. God forbid her leaving chicken for 3 months. For what, Kwan? Because feed is very expensive. So I'm believing that everywhere I still solicit for farmers' education. If you are not a farmer, you must be consuming what is produced by the farmer. And no matter how the level of your education, if you cannot go to farm, and you cannot teach those farming to get it right, you will be at the detriment of consuming wrong. And they say, eat what you know, and know what you eat, because you are what you eat. We are in this world today. Millions of farmers are there, poultry farmers, other animal farmers. They are doing this thing that we are condemning today in this world. They are doing it because they want to harm people. They are thinking that is the best practice. I still solicit for extension, active extension services in both crop and animal sector. Because our life is in danger. Yes. The woman who said they have a space, she was prescribing the feed for other livestock farmers in the vehicle. That one in 2 months, 2 months is even, okay, we know that 6 weeks, 7 weeks is even less than 2 months. She said she disposes at 7 weeks. And this big, she was naming all these big supermarket that comes to farm, the way they measure, they carry. And many people are going there to buy. Because big men buy in big shops. Even the small people are even safer. Because they go to the market, maybe they will buy old layer there. But this big one for big men. That is why I told people that there is a city sickness and village sickness. Because most of the dangerous sickness are in the city. In the village, they are eating more nutrition food because they enter their farm, they harvest their vegetable, cook it. Less contaminated. But here in the city, you see one ugu, very better ugu, you don't know what they use in producing it. And the big people are going for that fresher one, not knowing the content. Please, I want to beg, farmers' education is paramount. Our research work is very good, but research work is useless until it gets to the final consumers. The target audience of every agricultural research is the farmers. And the farmers, when they do not get it right, the consumers will consume it wrong. Please, I seek farmers' education is very important.
Thank you very much. Before the last question, we'll just quickly have a little interruption. The part of why we are here, seated here, because we have a support from the DFC. And on now, we have the DFC representative that want to join us. So please, we'll just cut short the question. Then our Vice Chairman of AFAN will have his question after the presentation. So Sammy is online. Can she hear us? Okay, she's on already. Okay. Please, all the alumni, can we have a standing ovation for her, please? A standing ovation for her. So please, you can have the floor. You can speak now. We can hear you. Please, can you unmute yourself? We can't hear you.
Hello, please unmute yourself. Unmute yourself. You're muted. We can't hear you. Unmute yourself. Hello, can you hear me? Can you hear me? Unmute yourself, please.
Please, can you remove your headphone jack from your system? I think she has a little technical error she's trying to rectify.
What do we do now?
Can you unmute yourself now?
Mm. We proceed.
Hello, ma'am. Can you please remove your headset jack from your laptop? It's like it's obstructing your microphone.
Hello, everyone. Can you hear me? Hello, can you hear me?
We can hear you. We can hear you.
We can hear you.
Yeah, while she's trying to sort out the technical issue, maybe doctor can start answering the questions.
Okay.
Because of time, while she gets, while she sorts out the technical issue. Thank you.
She's communicating with her. So what do we just wait on for her small?
Sidikat, we can hear you clearly, but let's just give her maybe 2 minutes to see if she can rectify it. So if she can rectify, then we'll proceed.
Okay, that's fine. That's fine. Thank you. Well done. Hello. Hello.
We are so sorry. Just a minute.
Hello. Hello. Hello.
No nation.
So you can talk now. I think so. Sammy, you can talk.
But can you hear me?
Yes, go ahead.
So you hear me now?
Yes, yes, we can hear you loud and clear.
Okay, super good. Thank you very much. And thank you very much for letting me into your meeting. I'm very sorry I could not be there for real with you. My name is Samuel Tipeta. I'm the Sector Councillor for Food and Agriculture with the Danish Embassy of Nigeria. So I'm very sorry for not having been able to hear what has been taking place for this 1.5 days you've been on. But still more, I would first of all congratulate the Danida Fellowship Alumni Group for Nigeria for organizing this very interesting 2-day event, with aim both to introduce alumni group in the professional livestock community and to share the learning and thereby build capacity on sustainable livestock development in Nigeria. This initiative is highly commendable. I'm so happy that it's happening right now. The Danida Fellowship Center offers learning opportunities for partners in Danida financed cooperation projects and programs in both developing and growth countries. It is therefore an important complementary to the government-to-government intervention, the strategic sector collaboration for Nigeria, that we normally call the SSC project. So the SSC project between Nigeria and Denmark in the field of food safety and livestock production is the first 3-year stage of a long-term program to support the green transition of the Nigerian food system. Efficient and sustainable livestock production with a high focus on chemical and microbiological food safety are core competencies in Denmark. This is based on a legislative framework, conditions focused on ensuring safe food and trained food producers through the whole food value chain from farm to fork. Through the SSC project, the partners will exchange knowledge and expertise in order to strengthen the framework, conditions, and supporting capacity building amongst the competent authorities in Nigeria.
The project will therefore achieve its goals through the combination of support for policy reforms and capacity building activities. The areas of collaboration are in the fields of feed and food management and control, farm and animal registration, and surveillance and management of animal diseases. So, at the Royal Danish Embassy, we are very well aware that the strengthening of food safety and livestock production is of utmost strategic priority in Nigeria right now, at this time, and we are indeed very happy to be able to contribute to this process. The training offered from Danida Fellowship Center has a particular aim to contribute to the building the capacity within the partner institutions, and beyond that, this means that the alumni group in Nigeria that you have right there with you is an extremely important instrument for the attainment of the goals of the SSC project, both by building the capacity of the partner organization and by spreading the knowledge and skills further beyond in the professional food and livestock production community in Nigeria. So for this reason, we are therefore very delighted to see here the strength and the dedication of the alumni group to contribute their learnings to the strengthening of capacity in the community by conducting this event on sustainable livestock production. At last, I also want to mention that the Danish government on the 26th of August, like 2 weeks ago, launched a new strategy for its collaboration with all of Africa. They call it the Century of Africa. The new strategy marks an increased attention and presence of the Danish government in Africa. For us in Nigeria, it is particularly encouraging that our collaboration exactly here will be strengthened as a regional hub for Denmark in West Africa. Moreover, the strategy lays out new ways of collaborating with Africa, meaning equal partnership, stronger presence, exchanges, and education. So also in this light, you can imagine that we can expect much stronger attention to the SSC projects as such, but especially also to the Danida Fellowship Program of Training and Education, which therefore makes the role of the alumni group even more crucial for the coming years. So, thank you once again for your great initiative and for all your efforts of passing on and spreading the learning from the DFC trainings in your community. Thank you very much.
Thank you so much. Thank you so much, our able SSC pointer, Mrs. Sani. We are glad that with your tight schedule, you are able to be here, to talk to us. That made us know we are not orphans. We have you as a mother. Nigerians have you, farmers have you. We appreciate you so much. And the farmers have been asking some questions. I don't know if you will have time to listen to them, or you want us to compile that in our reports. Once again, we appreciate you. And please, I would like all the Danida members to join me, stand up. Let's just clap as we appreciate her. Thank you. Okay. One of the key speakers said he have a special clap for her. So I give the mic to the facilitator that took us on antimicrobial resistance.
So let's clap for her once again, but I'm going to give an instruction on how to do that. We're going to start clapping 1 to 10 with one finger, 1 to 10 with two fingers until we get to the fifth fingers. So let's clap for her. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3 fingers. 4 fingers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 5. 1, 2, 3, 4.
Thank you so much. I hand over to the moderator.
Thank you so much for your time. We really appreciate. We have the last question before our facilitator will give us the answers to the questions. Thank you, sir.
Thank you, the organizer, and really, we are really appreciate by involving the farmers in this country. I really thank everybody that have done that, and they really like to use the opportunity to ask a little questions on this issue. My question is on data collections. We have a poor data collection in the country because farmers that are involved, both animal and crops farmers, are not fully involved in joining to do that. Second one is the training and retraining of the farmers. We should look at it as one of the basic things. We need more training and more retraining and more also to carry the training to the grassroots. It's very important. But it is money. In fact, without that money, you cannot do that. So we the farmers in the country is asking if there is a way we should get funding, a little funding like grants, to go into all these data collections and the training and retraining of the farmers. Thank you.
Thank you so much, the Vice President of OFAN. So I hand over the microphone to our able Dr. Rilwan.
I used to be a doctor. I'm Ridwan now. And thank you very much for those questions and comments. I sincerely appreciate, because I thought after the talking, because sometimes I'm too loquacious, I talk too much. I thought people were sleeping, so I think I'm happy that you're asking questions, even though I may not be able to answer all your questions, but I will try to respond to them. So the first one was I can't remember his name, but he raised a very important observation in the use of the terminologies antimicrobials, antibacterials, antifungals, antibiotics, antivirals. So when we say antimicrobials, it's a general term. I didn't want to go deep into classifying antimicrobials. But if you heard clearly in the definition of antimicrobial resistance, in the literal definition when I mentioned, I said when microorganisms like fungi, bacteria, viruses, parasites. So it means antimicrobial is a generic name, is a terminology used generally on drugs that are used to treat infection from virus, bacteria, fungi, parasite. Okay? In akwai masu jin Hausa nan, suna gama gari, meaning is a general name for the drugs that are used to treat them. So, but if you take each pathogen, bacteria, you want to treat bacteria, you use antibacterial, but it is commonly called antibiotics. So antibiotics are used to treat bacterial infection from bacterial organism. If you want to treat fungi, you use antifungals or antifungal drug to treat fungal infection. So you need consultation, you need to know to differentiate between a bacterial infection and fungal infection. And sometimes you may not be able by observation. If it is systemic, you have to conduct a test. So that means you have to consult a veterinarian to give you, or a lab scientist. You will consult nearby lab if you have a lab close to you, for them to test to know whether it is a fungal infection or bacterial infection. Okay? If you want to treat viral infection, it has been established that maybe it's a viral infection that is bedeviling your organism, your animal. You use antiviral drug. If you want to kill or you want to treat parasitic infection, like in humans, malaria parasite, for example, you use anti-parasitic agent. So this parasite, there are plenty. I mean, there's one comedian that uses plenty. I don't know. I only see him on TikTok. He passed by. Everything is plenty. So you use specific for each parasite. Malaria parasite is a different parasite. So you use anti-malaria as a parasite. Okay? So generally you use also protozoans, antiprotozoans as a general terminology. So, but if you want to combine all of them and you want to give them a term, that is why they are all called antimicrobials. Because all these pathogens, they are microbes. They are small, small organisms. They are called microbes. So to give them a general name, you use antimicrobials. But because the irrational use is more on the antibacterial drugs, that is why even globally, prioritized pathogens for surveillance on AMR are mostly bacterial pathogens. But we're not saying other pathogens are not relevant, but because that is where we have seen the threats based on the report in 2019 that I mentioned. The resistant pathogens that were identified that were associated with antimicrobial resistance were bacterial infections. Even in animals, mostly is bacterial infection. Those are the prioritized pathogens. You know, organisms, let me call them organisms because we're using bacterial to differentiate. Okay, I don't know if this is clear to you. We are not using antimicrobials interchangeably with antibiotics, but I emphasize on antibiotics because they are the most abused drugs. Antifungals, we have just few antifungals in the country in circulation. So we are not likely to have that high incidence or high prevalence of antifungal resistance pathogens within the country. It exists, but then the most abused, the most irrationally used antimicrobials are antibiotics or antibacterial. I don't know if this, if I have been able to respond to that, but if you have more, you can share with everybody. Somebody said 95% of farmers are not organized farmers, meaning they are not in a community, they are not organized, they don't have associations and all this, they are not captured. I don't have that data, but literally I can agree with you that most people, the peasant farmers, they don't even know that there is a regulation on how to farm and all that, so they're not aware. So these are some of the things that we identified in our national action plan in addressing AMR. The first strategic objective for our national action plan is awareness and education. Awareness and education is the first strategic objective in our national action plan. So in that awareness and education, it is a cut-crossing strategy and interventions in both humans, animals, and environment. What awareness messages are we going to pass for people working in the environmental sector so that they'll be able to address issues of environment? What awareness messages do we develop for farmers, for people working in the abattoirs, for veterinarians? How are they going to manage patient or clients by rationally prescribing antimicrobials, by appropriately utilizing diagnostics before they manage animals. They are all part of education and training. And part of that strategic intervention under the strategic objective awareness and education, we also plan in this second national action plan that is about to be launched to include antimicrobial resistance into secondary school curriculum, because we realize that due to poor education and awareness, we need to catch the children young for them to start having this awareness. They might not become veterinarians or medical doctors or healthcare workers, but majority of them might end up as farmers. Okay? They will definitely become parents. How do they use antibiotics rationally? So that plan is already on board. We have started making consultations on how to include AMR into secondary school curriculum and university school curricula. You understand? So that we don't have issues of awareness. At least at that formal level, we are going to incorporate into student curriculum. Then coming to the communities, if you know the World Antimicrobial Resistance Awareness Week that is being celebrated, commemorated every year from 18th to 24th of November every year. Nigeria has been commemorating this officially since 2017. And we do it collaboratively with the human, animal, and environment. We come together, we go out to the field, we visit farms, we go to the market square to create awareness. It might not be enough, but then we have started from somewhere. So with you now here, you can be part of the community of practice, on antimicrobial resistance. Because we have a national community of practice where people share ideas. It's an online platform. And before we leave, we can share the platform, the link to the platform, so that you can go there to pass information, to share experience, and get information, because people will be going there to provide their experience, provide, a lot of information, and grant opportunities. Somebody mentioned about grants. So we also put opportunities for grants for farmers, for healthcare workers, capacity building opportunities, project implementation opportunities, data balance, and all that. The government may not be able to do all that, but then we scavenge for opportunities and share link on that community of practice platform, and it is a One Health platform. I think this will address some of those things. How do we dispose expired or unused drugs? Generally, for both humans and animals, there is a regulatory framework, there is a policy on disposal of unused drugs. Usually, when you get an antibiotic or any drug from the pharmacy or in the hospital, if you are not able to complete, one of the things the doctor is supposed to tell you, or the pharmacist that dispense that drug, is that you should try as much as possible to complete your dose. That is the job of a pharmacist, to educate you on how to take the drug, how many times, what time of the day, when do you stop. And when you are not able to, for some reasons, you need to return the drug back to the pharmacy. Yes, if it is expired, the ideal thing is he should tell you how to dispose. Bring it back. Disposal of unused drugs is the duty of the pharmacist where you got that drugs. That is the regulation, that's the policy. So you're not supposed to throw it in the bin or in the sock away, because that is taken back into the environment. Okay? So that is the ideal, how to dispose. Same thing for farmers. But the problem is, how do you even get those antimicrobials as a farmer? We go to measure them as modules now. 1 module, 2 module of tetracycline, 1 module of this. You buy in modules. So those people that even sell, they don't even know whether they're antibiotics or they're analgesics. Buy analgesics, antibiotics, and every 1 module so that you can afford. You don't need to buy them separately. You mix, you blue, red, 1 module of antibiotics for animals. So we need to have this awareness and education so that we get those drugs where we are supposed to get them. If your Bible had all the sunlight of this world, 24 hours every day, they put them under the sun, and then you are taking them for animals, they will not work. Animal may not show you, you may not observe the side effect of those drugs, but it can, if those expired drugs, they can lead to reduction in productivity. It might make your animals to be stunted because you bought expired drug as a side effect. Maybe they may not have those side effects, I will see them manifesting, but in the long run, it will affect productivity. So it's good to know where to buy medications for your animals, especially if you are into business, farming business. You want high yield. You need to invest well and know where to get those drugs, because there is a storage temperature for every drug. They can get expired before the expiry date. So that is just a digression to what you asked. Then food sustainability is a comment. Then One Health awareness, that has been responded to. Then the farmers' inclusion. Yes, I agree with you that, and the reason is because most of the farmers are not organized. If you want to engage farmers, you have Nigeria Farmers Association, or National Farmers Association. We have National Poultry Farmers Association. You have different associations. But if you look at those associations, they are Abuja-based. Most of the time, you see farmers that are not farmers because of the benefit that is there. Some of them, they do not have any farm, but they are president, they are secretaries of farmers association. So in the long run, whatever benefit comes, it will not get down to the farmers, the actual farmers. And the farmers are not aware on how to put down or put up their complaints or their recommendations. Because we shouldn't look down on the farmers because they are on the field. They know better than the farmer that is in Abuja sitting in his office, claiming to be chairman or president of Farmers Association when he doesn't have any farm. You understand? So I think this is a discussion that we need to have, and the Ministry of Agri will take note and strategize on how to actually reach to the real farmers. Reach out to the real farmers. And this is already captured on our National Action Plan on EMA. Because if we are doing awareness and education, we have to identify you by your farm for you to be part of our program. We identify you by your farm to be part of the program. So that is the level we can go as the National Technical Working Group on EMA. But the Federal Ministry of Agri has that responsibility, and I'm very sure she's taking note to strategize on how to get the actual farmers, both in animal farming and the crop production. There are a lot of things happening, where the farmers do not actually get the benefit and do not get the information they require to improve on their yield, to know a lot of things. Exactly. So I assure you that the Federal Ministry of Agri is here and they are taking note with those recommendations, and I'm very sure they will take actions on them. So I think I have responded to some of these questions. Thank you very much.
Very big round of applause for Dr. William. Sir, is it? Okay, let's give you 1 second.
Thank you very much. What I want to say is an issue that came up from the response of the presenter of the paper. Let us not leave these premises with the information that farmers are not organized. We are organized. First, farmers are organized under commodity associations. We have Nigerian Cassava Growers Association. They are cassava farmers. We have Potato Farmers Association of Nigeria. They are potato farmers. We have Rice Farmers Association of Nigeria, RIFAN. They are rice farmers. The same category of commodities all over Nigeria. Ginger farmers are organized. Sorghum farmers are organized. Apart from the commodity associations, we also have an umbrella body that caters for these associations and that these associations are under. And that association is All Farmers Association of Nigeria. So farmers are organized. It falls back to the table of the Ministry of Agriculture and Food Security. It falls back to the table of the Federal Ministry of Environment, Federal Ministry of Science and Technology, Federal Ministry of Education, Federal Ministry of Industries, Trade and Investment, to find out how to reach these people. What they do is just they meet their cohorts and then they carry out programs with them. And therefore, when you bring policies, farmers are not aware. Farmers cannot bring in what is supposed to be done inside that policy. So farmers are organized. If you really meet the commodity associations, they are organized. If you want to meet the umbrella body, the mama and papa of all the farmers is All Farmers Association of Nigeria. And the National Vice President, Ruth Antuba, is here. And even our national president is aware of this meeting. We also have farmers associations in all the states. We have FCT, we have Delta State, we have Lagos, we have Borno, and so on and so forth. The chairperson for AFAN, FCT, is in this meeting. So let us go home with the right nuances concerning farmers associations. Having said that, based on the response that we have got, the farmers have been crying that NAFDAC essentially have not done what they are supposed to do. In the area of pesticide, this is what farmers are suffering. Farmers go out to open market to buy pesticide. And the quack that is there selling pesticide is the one telling the farmer what to buy. And so there is need for NAFDAC to streamline who are those that should sell these pesticides. Ditto what we have come here to do. Who is it that will sell these antibiotics, anti-micro, all the antis? Because as a poultry farmer, I have a poultry. What I do is get to the junction of my street. There are about 2 or 3 sellers. They are not even big shops. But when you go and you buy your feed, and you tell him, my chicken is doing like this, he will now tell you, he's a quack. He will tell you what to give the chicken. He's a quack. He's neither a vegetarian, neither a chemist, nor a biologist. So what would the farmer do? Therefore, it still falls back to the table of the ministry to really streamline who will sell this thing to us so that we don't buy from quacks and we don't take the wrong things. Thank you very much.
Thank you very much.
Is it half or one? Half.
What my chap concerning farmers education. Please, we have said it and we mean it. Please, is how it will help us to educate the farmers, because the more you educate the farmers, the better for everybody. We have anti this, anti that. We have to anti you have to be careful for whatever. I want to use this opportunity to say to talk about some of our farmers in Kwale Area Council, because all of us here eat akpu. At least all of us here, most of us eat akpu. And because of this lack of education, some of the akpu producers, they don't know what it means, what it takes to do the akpu. Some of them are using clean to soak it. Yes, they use clean to soak it so that to soften the apple, so that they will make money. because of education we are talking about. And we'll go to the market, we'll go and buy it and eat. We don't know what is happening. And tomorrow we'll start sick, one sickness or the other, cancer, this and that, liver problem. Please, if they have been educated, all those things will not be happening. They will know what that is how you pick cassava. You soak the apple, it will do very well. But then there is how you pick the cassava, you soak it 1 week, it will not soften. That is what I want to say.
Thank you very much. God will save us from anti-apple. Well, we are moving into the next presentation. Our prof is ready. But before that, can we all be on our feet? Can do little exercise. Prepare ourselves for, to prepare ourselves for prof that is coming to give us the little, let's just stretch ourselves. Who give us a exercise? Who want to give us exercise? Do you have anybody? Music intro. Okay, you dance. Give us little music intro. Let us do exercise small. Oh yeah, just little music now, so that people will just shake their body small. Yeah, shake. Oh yeah, now let's go. No music. Oh, sorry, there is no music. Okay, if there is no music, do like this. To the right. Oh yeah, let's be on our feet now. Oh yeah, to the right. Thank you very much. A round of applause. Prof, please, can you have the floor? A round of Prof as he's coming to give us another powerful and impactful, insightful presentation. Thank you, sir.
Hello, everyone. Okay.
Alumni members, please.
Come with the facilitators.
get settled, as we are settling down, let me begin by doing some appreciations. One, for the Danida Fellows, who have given me the opportunity to have this conversation with my fellow farmers. Two, I'd like to sincerely acknowledge my members, my primary constituency, Afan. I have my friend Chris, and I have Chief Okafu here, and other members. This relationship dates back some 20 years ago, working with the farmers, and I know that I truly confirm that you are organized. And I know that you have associations across commodity lines and many other things. But I think that I'm happy that we are being challenged to do more. I'd like to also deeply appreciate the Danish government for supporting us as a country. Many respects. One of it is by having, and I'm also aware of the fact that I will soon have another that has to do with food policy coming very soon. By the way, I thought my name should be. My name is Mekano Mohammed Ali. I happen to belong to all the groups. I'm a farmer, like I said. I've worked with AFAN, and I've been a teacher all my life. And each time I teach, especially anything that has to do with feed or animal food, whatever you call, I start with one basic question. And I like to see it here. It doesn't matter whether I'm teaching at the levels of ordinary national diploma or to that of a PhD. The question still resonates. Maybe you will try it in this class. Let me consider this to be a class before you to go into conversation forum. What is the difference between food and feed? No, you, not you. One person will not answer this question. Yes, madam.
Feed na the one animal dey chop.
I don't agree with her. Oh. Me, I don't agree. Yes, I have a right. Thank you, madam, for disagreeing. Who else will have a different definition? Yes, sir.
To my own understanding, the difference between food and feed is that they are both food. They feed, they nurtured, they vitalize, and they also increase nutrients. So food, to me, and feed, the same thing.
We can even clap for him. Very good attempt. Any other one? If there is known, gentlemen and ladies, the difference, oh, you want to try? Please attempt. I like that.
Food is that which we take in, we ingest, and then feed. I think it's for the animal, or feed is the process of ingesting. I don't know. But that word ingestion.
See, basically that's the problem we're having. The only difference, as far as I'm concerned, is the two E's and the two O's. Yes. The E's and the O's. Otherwise, food and feed are same. And that's the reason why today the livestock industry is in very serious competition. Because we go for the same materials. Correct? The same biological processes. The same agronomic processes. The same market. So it makes it much difficult from the moral angle to look at
For instance, your child that needs pap and your chicken that needs corn, and they're all for the same and the O's. If you don't count all those, we can use the same. The activity still remains the same. Same biological process. My sister started by saying, what do? We ingest, right? The animals do what? They will do what? Digest. Breakdown process, right? The animals do what? Will do what? Absorb. The animals do what? Will do utilize for growth, for milk production, for all the other activities that we do. Same with the animals. So it becomes fundamentally important that for us to get it right, looking at the comparative advantage, we must look at what we can do differently. Sorry, I don't know, my slides have not been presented so that I can be guided. I don't want to. Yes. We are saying we should have a sustainable process of producing this feed. Can you imagine that the animal feed industry is $1 trillion industry? It's $1 trillion industry in Nigeria. And I can assure you, all of us in one way or another are either involved directly or indirectly, or have the capacity to get ourselves involved in the feed value chain. What can we do? Let's understand, all of us know, either as practical farmers or as theoretical farmers, those that will publish and write with the books, that the chicken, your pig, your other livestock require as their capital 70% of the funding goes to feed. And if you are keeping room, worst case scenario, you want to do a production system that will help, you could have to invest not 35 to 40% to the feed supply chain. The number one challenge that we have, we have all agreed, is the E's and the O's. We go for the same market, and the same raw materials, and the same resources. And unfortunately, policy has not supported the livestock industry. I give you an example. There's what we call strategic game reserve. Am I correct? What does it care for? In terms of food shortages, what do? We pump it into what? The human food industry. Do we have any strategic feed reserve for the livestock? So, okay, it means, okay, let's say we are going for the same corn. Is there any way we can be able to have separate pricing regime for the feed that will go to the feed millers industry, or to the feed that will go to the poultry feed millers industry, or to the feed that will serve as a concentrate for your dairy cow? Is it going to be possible? Yes, it's possible. What can we do? Alpha and take the challenge. Of farmers that will specifically devote their interest only in the production of feeds that will go to the animal feed value chain. So that we can request government incentivize this group directly. So that we can request research, help them with the capacity to do more in a reduced cost. That is what countries do. I give you an example. When we have feed challenge, first solution has always been that we should look for alternatives, right? We call it alternative feed resource. They are in many formats, and they also go along with their challenges. But first and foremost, for any feed to be considered and be counted as an alternative, it must have so many characteristics. One, nutritional advantage, it should have the same comparative nutritional advantage you want to change. For instance, soybean and canola. Canola seed, right? It should be also be available cheaply. Am I correct? Otherwise, even if it's good, if it's not available, what happens? Doesn't make sense. And it can also have a comparative price, because the major determinant of every feed that you feed your animal is the price factor. That is why today all of us are shouting, cost of egg is what? Let me start for the lowest form of product. What? So you can imagine. So you can imagine, even the common man cannot have egg. So you can imagine, can we turn this issue into an opportunity point? Yes, we can. If, for instance, Oga Okafor group will decide that, okay, can we produce canola or any substitute, soya and locust beans, many other beans, the oil seeds that are not in too much in demand? Don't go for that has a international price for oil and for utilization in the biscuits industry. Look at it from the perspective of the fact that it can only be narrowed to animal feed. I give an example of canola. Canola is as good as soya, except for one factor: fishy smell, quality of production. So this is where science comes in. This is where research will now have a role to play. You can think about what can we do to remove that fishy smell. How can we do to make our Nigerian environment productive enough to produce it? How can we make sure that as we do this, our farmers are so engaged and so specialized? Just like we said, not every kind of farmer. We can now say canola farmer. Or if we want to use BT cotton is coming now. How many of us have seen that as an opportunity? BT cotton is a product of research in Nigeria. You don't know that, right? Yes, your neighbors here in Abuja, agriculture, what do you call it, biotech. Basically for the what? The silk. Yeah, the latex, right? Why don't we look at it to go into the chain as either collectors or people that can do some processing, a little bit of quality improvement activity, which we cost, which is very, very possible, and then have that improved. Now, by the way, one of the things that we have discussed long all through the presentation of yesterday and today is about microbes, right? Can we do without microbes? We can't. We simply can't. My sister was complaining, and I enjoyed your voice, but I like your passion, and that 8 weeks is what? Too early for chicken to grow. Yes, fundamentally, people were using microbes, antibiotics, as growth-promoting materials, additives in feeds. Yes, people were doing it from the point of view of, can I see that minimal infection comes into my farm? Yes, people were using it for many other reasons. But over time, we've discovered that it is not a good practice. And the reasons are very obvious. One of the things that I can show you practically that you hardly understand is that keep your chicken for a period of time. Consistently follow up what happens in your poultry pen, your pen, and continue to use biotics frequently. Then God help you the moment you have any infection that has to do with the antibiotics. You see that in you will not understand what happens, including as well as what you call typhoid. It keeps staying longer. It requires different kind of dosage. It requires different kinds of examination for you to be able to get the right strain that will solve your problem. It is because of what? Your exposure to the farm. You can see that you are trying to create an environment where your animals will do well and benefit, and you end up yourself being sick. 2, it was not just a practice here. When you see advanced countries where there are regulations, normally standards of feed are in 4 categories. Let me give an example of poultry. There's what we call starter, a mid starter, grower, finisher, finisher 1, finisher 2. Within a span of less than 6 weeks. And the reason is that at the last finisher stage, it is a withdrawal period. That feed at that level essentially does not contain in any way at all antibiotics. But that practice has also been improved on. And we are going back to where you see value more added when we have natural processes involved in the process of feed. I'll stop there. Now, let's look at our other ruminant animals. We know that God in his wisdom has decided that they should have 4 compartmentalized stomach, right? We all know that. One of the chambers is all about what? Microbes. Same bacteria that we're accusing, right? Same fungus that we're, same parasite that we call parasite. So you can see now we're introducing a different language. We call one pathogenic and the other one no. Do you understand? And the concept is simple. It is about what we call competitive exclusivity. It is about competition between the bad guys and the good guys. The GIT would ordinarily depend on these microbes to be able to do that process you have mentioned, break down, absorb, convert into your body nutrients. So, if you allow the bad guys to be more in number, they will dominate the GIT and then exclude the good guys away. So, you know we have in vitro and in vivo processes. When you want to dominate, we are only 5 people here, right? We want more bad guys to do. We just go to invite the Agueros from outside to come and populate this hall. What will happen if they come with their kid and cutlasses? All of us will run away, right? So that is an in vitro process. When you produce and add antibiotics, antimicrobes into your feed, you are bringing what? Increasing the bad guys to come and isolate and dominate over what? The existing good guys. And the other way around, you can do what you call probiotic processes. Bringing probiotics into the feed in vitro. You are helping the ones inside the system to grow further and dominate the GIT and make themselves more available, relevant to the digestion process of your animal. Good. Now, let's go to ruminant animals. Like again, we are still on ruminant animals. And this also applies to you and I. Understand it, depending on where these habitats are, whether at the first floor or at the last floor or the middle floor or wherever, you have microbes helping you in digestion. That is why we are encouraging you to have more fiber in your food. Is that also? So that it serves as what? Phytogen, you understand? To help in the growth and multiplication of the beneficial microbes. So also with animals like rabbits and horses and the rest of them. In fact, of whatever they do, they go to the last end and they still meet with the microbes to help them work further on their feed system. What is the opportunity for us? Please go back. What is the opportunity for us, like I've said? There's what we call circular economy. Who is aware of that? Like I said, all of us have a role to play. We, directly or indirectly, there's no reason why the farmer and the livestock producer should have any problem. By the way, all farmers, all crop farmers are by their activity producers of the first requirement of the animal, which is what? Food. Whether it's a byproduct in the farm or a byproduct in processing at home, it is recycled and it is used back as what? Feed to the animal. But, sorry, let's go up first. Okay? So, what do we need to have some very homemade domestic processes that are known to us so that we can be able to convert what we call waste to major gains. Major gains in the sense that you would make money, you would keep a clean environment, you will stop the fight between the herders and the farmers by simply collecting your farm leftovers, your kitchen leftovers, melon waste, your cassava waste, your rice offals, by converting them into feed. All you need to do is what? There's this that I would say in Nigeria, in the Nigerian palace, polish, what do you call polish? When you want to just decorate something, give an image. Packaging, my sister. All you need to do is package it well, do a small analysis, and you're in the market. I saw firsthand for myself where a Fulani man went to buy heaps and heaps and heaps of cassava from a thief man. For those of us who are in the South Central will understand that. These are the two fighting groups, dominant fighting groups. I was part of the interaction. And already the thief man, the Fulani man was already feeling threatened by the fact that people have discovered that they can use cassava waste into doing this brisket thing. So those doing briskets came for the same material that the Fulani man wanted. And he said to me that this material, if we don't take that in the future, we can't get this thing. I said, mend your relationship, because I'm a Kanuri man. So I was able to play with the worth of them. I said, mend your relationship and go forward. Otherwise, tomorrow you will not have feed. What else can we do to increase the value of this? Simple fermentation. All feed materials. And the reason why we hang on to soda and soybean and maize is because of their safety value in terms of what we call anti-nutritional factors. You know what it means, ba? For those of us in the feed industry, those factors, for instance, in cassava, that cyanide in cassava that will not allow you to consume it, that phytase in soya and many other seeds that will not allow you to uptake the feed that is required for energy production, that glycosol in maize, in groundnut, and all of those materials that makes it so difficult for you and the animal to digest feed can be removed by fermentation. And you know the value of this fermentation? As you are fermenting, you are adding the additional microbes that are harmless, are useful. That is why today everybody is going for organic food material. These are things we can do at domestic levels. How do we do that? The strategy is, can we see for ourselves, build business models starting from efficient supply management, from area of point A need to area of point B supply. Let me give you an example. There is no cattle or cattle market that you go around in this country today that you don't see people that sell pasture. Is there any? Or sell dusa, harawa, and the rest of it. And I can assure you There's no space for that kind of program here in Abuja. It means that it's a business opportunity. But I know that for sure there's cattle market in Abuja. It's a business opportunity. How do we efficiently transport those materials? It goes back to that kind word that I got from my sister. Packaging. Packaging simply means, do we do additional value addition? Can we chop, for instance, our hay? Can we cut the silages into a pit that can be made properly, labeled properly, so that you do not incur extra cost of transportation? Can we put our dusa in bags that are clean and perhaps even write a label, 60% or 2% crude protein, whatever, that gives that farmer that will buy a nutritional information? Can we chop our farm stacks, our maize corn, and grind them, do a lot of polishing in it, package it well, and provide and build business opportunity? By the way, our geography, let's go back to elementary geography. When you see the map of Nigeria, the first thing you learn, they will tell you that this is Sahel Savannah, Guinea Savannah, whatever, down to the mangrove. Am I correct? They no longer exist. We have a huge landmass that will Sahel Savannah. Funny enough, the largest animal holding is what? In the Sahel Savannah. So invariably, the only commodity you and the animal need is food first, and water. Am I correct? Food and water are something, whether you fast for whatever, dry fasting, open fasting, you still go back to that. Food and water. Because of that, we must that there is a supply chain. The pastoralists, irrespective of whether you call him crazy, mad, whatever, will want to make sure that his animal gets the feed. Can you build a business relationship? They've done that in rice. Lagos Kano corridor, the HKK corridor. AFAM is involved. I know I'm aware of that. Why don't we, and it's supported by USAID. I hope Danish Embassy could also help us with that kind of system. For instance, if you go from Ibadan all the way to Ilorin and all the way down to Lokoja and Kogi, you see grasslands that are underutilized. Free of charge, you do a community service even. It's a community service, you cut those grasses, package them, put them in a system where you have a market opportunity elsewhere, collect them, and the farmers are happy and everybody makes money. And the country is stable. That is something we should think about. They come to the Benue Valley, Niger, Kwara, Plateau, Nasarawa, and the rest, because earlier around there is pasture availability. It's not because that's just one reason. That's it, nothing else. If they get it, they go back. And in the process of coming and going back, many issues happen. So why don't we stop it? That's what they call Nubia philosophy. Not in my backyard. Can we stop it right there? We don't have to have a backyard. And make money. So, if we have an efficient supply chain where groups identify themselves based on what they are capable of doing in the value chain, the chain is $1 trillion industry. Take it or leave it. It's not a joke. It's a business opportunity for everybody, including the kids in the house. Go to some of our neighborhoods. Just leave Abuja quietly. Cross over. You see heaps and heaps and heaps. Rice and the rest of them. Go into the interior, even in the Karo area here. Brukutu joints, what happens? Brewers dry grains, right? They are all what? Feed materials. And these are the type of feeds that are safely available only to us animals. Right? And the human beings have no reason why they need it. Now we are allowing them to look at the values and the opportunities in that by using that as fertilizer. Why would we want to do that? If your sugarcane waste, scraps, everything that you can do, you can convert it into feed by this simple biological process of fermentation. My sister, I wish you were around, but she has just gone now. Yes, I can assure you, process, there are major ways of doing it. You can have a starter culture, one, just like you do yogurt. You can boil, you can heat boil, and ensile for a period of 32 hours. It will develop itself a starter culture. For instance, major materials like, what do you call it? Rice offal. You can see the reason why you don't use rice offal so often because of what? High fiber content, right? You can break the fiber, you go to abattoir, that the rumen. Yes, just use it, sprinkle it over a material. That's what you call tempering. Tempering means water, put it over a period so that it's going to be moist. And sell and see the wonders. Bring your whatever sugarcane scraps that were having, clean it up, remove the dirt, put that process, and do the same process and see wonders. But when you're done with this, dry it properly and include in your feed. You will be amazed. First, there will be cost reduction. Two, there will be increase in growth. Then there will also be no need to use crops. Yes, antibiotics. We have all agreed that one of the measures we can do is what we call measures. You are trying a farm that is not a tourist farm. One of the things that we do cheaply is that everybody that comes to us to visit us will take him to our farms. That's a tourist farm. Do you understand? We should stop that. Do biosafety precautionary measures, including for us. I've been to farms where, as a person, I have to do everything, including removing everything apart from your orders. Wear the dress, and get your dress. You are disinfected all the way through. Because it is a heavy, especially for poultry. So when you are able to do that, and you regulate the environment that you can produce well, we're in business. So I don't know where I don't know whether I'm not sure I've my slides. I don't think so. I've lost track of my slides. I don't know. So okay, like I said, this independence. So I'm just talking about it, right? Biosecurity, use fermentation products as probiotic inclusion into any feed, reduces the reality of dependence on antibiotics. Enhancing animal health and immunity, yes. Your immune level of animals are improved through prey and probiotic inclusion. Prey, and these are available to us. For instance, there's garlic powder. There's a lot of other condiments. Like I said, I find it difficult to remove feed from food. These same materials that you add in your feed for your full protection, they also help in what? Supporting the immunity of the animal. That you can add as levels of inclusion. They are supplements. They are what we call supplementary feed. So, by and large, we must be able to sustainably. Also make sure that we must do some health promotion practice. Remember, when I started, I said one of the major areas we have ourselves in contact with antibiotic resistance is when we go to our farms, we work with farm implement, and the animals are already fed with antibiotics, we end up being the first victims. The technologies now, again, it's like a fermentation products. There's AMI's technology that you can even produce you can go into your farm and eat food. No smell of any kind. because the microbes will work litter and what do you call it? It is odorless and is free from all kinds of. I'd like to once again thank everyone for listening. Let's enjoy the conversation. Thank you.
Another round of applause for the prof. No, prof have assumed that all of us were students, just flowing in the academic way, and we are all grappling it little by little, small by small. And, we are digesting and activating what you have said. It's time for questions. So, how many people have questions to ask, Prof? Okay, one from there. Question 2, 3, 4. Question? Contribution? 5. Let me say again. 1, 2, okay, 3, 5, and 6. Set. Okay, sir. All right, sir.
Good afternoon, all. Thank you very much, Prof, for the knowledge addition. I want to ask on the use of processes of fermentation in raising broilers. Is it practically available now, the processes? And is it like a supportive form of feeding to the broilers, or they can live exclusively on that fermentation processes or on feed from fermentation processes? And how will somebody manage the probable aflatoxins that may arise from? Okay, how can somebody manage the probable may arise?
All right, good afternoon all. Thank you, Prof. Sir, for the presentation. Well, I just want to know how one can control the bacterial organism that is in the ruminal liquor, considering you talked about using it for formulating feed. You know, the intestinal lining has lots of microorganisms. So if you're using it to feed your animals, be it poultry or goats or whatever you want to feed them with, don't you think that could be a source of infection to the animal, considering the lining as a storehouse of microorganisms?
Who's my number 3?
Good afternoon, Prof. It's a pleasure having you. I asked a question yesterday, and the national coordinator asked me to defer the question till today. But I don't think I want to repeat that question again after having heard you. I had these instances where I'm talking about, my question is on alternative feed. So, I had the privilege of watching a video of local farmers, livestock farmers, trying to breed a patta cow with a coffered cow. And they brought in inorganic materials like ammonia and the rest of that, and mix it together with fodders, grass, with ammonia, that is kaunwako. They mix it together with fertilizer, let me use the right word, and then fermented it. I attended a workshop in International Livestock Research Institute, and we were there for 5 days. At the end of that
workshop. I wish the government can do something about that. Just like we have you today, sir. The little brief I have from you leaves me with a pain. How can I contribute with this? But I think there's hope for this country. If you have your answer. As we listen to you every day, something will happen. And then we can go down to technology. I read agricultural engineering. I don't think I've ever fabricated any machine. But I know I can do that. But there was no enabling environment. So I do things in the house. And my children look at me and say, Daddy, are you okay? I say, what I cannot do, you can do. So my question, straightforward, is that you mentioned the Danish Embassy and all other organizations that can come to help farmers. With the lecture we had today, we can bring ourselves together to a cluster, commodities. We are processing commodity. You mentioned canola. We can have canola commodities. We can have, what you mention again? We can have those commodities, sir. And then have, embassies, NGOs, development partners to sponsor this. And our farmers, they are just, like the one I mentioned, they are innovative. All they needed is a bridge to bridge the gap. So, in your capacity, I don't want to ask you again, what can we do to move forward on this platform? Thank you, and God bless you.
Thank you so much.
Prof, thank you so much. With you, there will be more knowledge today. Like when you were lecturing me, I always tell you, Prof, I need you to come to class because each time you come, I learn new thing. And today I've also learned another thing. You taught us of how to produce probiotics through the extraction of microbes from the GIT and that of fermentation process. I want to know, it's not very clear to me, maybe the similarities or differences in such a production. Insight on how to improve the quality of a protein source through fermentation. Thank you, sir.
The second to the last question. Madam, Prof, someone has linked a question. Thank you, sir.
Thank you very much. I don't know. I'm so happy that my audience are with me. Beginning with the first question about practicality of fermentation. I tell you, with due respect, my inaugural lecture was all about it. I've done so many crazy things about fermentation, including harvesting microbes from local chickens, what we call IMOs, indigenous microorganisms, to put it and recycle and ferment and have animals. My PhD students are there, one is here. Okay? We have done different things now. Fermentation is a very simple process that is happening every day in our lives. Instance, there's the dawa, you know it. All the women in the house, you know the value of the dawa more than anything else. So, it's a practical thing. That let me also join quickly to answer your question. Aflatoxin, yes, it's a reality. I'm not talking about, I'm not saying you should exclude binders, but it's not the issue. When you have aflatoxin coming in, is when it is not properly dried up. Any material that is fully dried will not have that. Then that also takes you to the level of how do you store it. I hope you understand. Now, the next question you asked, human liquor rumen waste, rumen everything can be used in the feed safely in different ways. I give you an example. My sister here used mucus, right? Maggot, right? To serve as a protein source. Maggot, yes, maggot. Yes, maggot. Maggot. She's still a legend here. She can tell you that herself at an appropriate time. My using rumen materials are enriched materials. Basically, there are two products. Three, basically. Let me add three. One, degraded feed material. Two, volatile fatty acids. Remember that. Butyric, propanoic, and acetic acids. Do you understand? And then the third, the microbes themselves that have converted these materials into their body protein. So when you sun dry it appropriately, proper sun drying, do you understand? You can use it directly in the feed in the quantity. I'm not saying you should use it. After all, look at the nature and type of the feeding habit of a local chicken. What does she do? She picks maggots. She picks rumen materials. That should stimulate your interest into what would happen. Now, the liquor is an infiltrate. You are filtrating the liquid material from the rumen liquor. That's what we call it, rumen liquor. It is not itself the feed. It is what? It's a starter culture for fermentation that will break down the process of whatever rough having what, because that is why your cattle can eat every kind of feed and convert it into usable protein. I hope you understand that. This is an in vitro process. Like I said, there are two processes of food enhancement, from outside and then from inside. So when you bring a feed material, for instance, rice offal, that you are limited in utilizing it because of what? High fiber. To how many percent? 5%, right? Am I correct? You cannot in a poultry feed add more than 5% of rice to feel safe. When you ferment rice offal with rumen liquor, try it. You see that it will come down to more like a powdery form. So dry it well and you can add it up to about 15% to your feed. Is that not the cost saving? I hope you understand. It's all about drying. Now I'm happy my engineer friend is here. I thought you should be thinking about collaborating. Fermentation vats can be created by him. Dryers can be created by him. And then we can have safety. That will be no longer a local process. He can provide. Fermentation is about temperature and activity of microbes. That he can be able to regulate the temperature, create a large tank or a vat, and allow the fermentation process to flow, where you can distinguish between the byproducts and the materials, and then he can move it all the way to a sun drying plant, maybe a sun dryer, or maybe a sucking arrangement. You can use many other processes of drying without necessarily losing the value of the material that you are drying. Am I correct, sir? Engineers can do that. So that's the difference between what we are doing. And that is why I'm happy to tell you, as Dean of Postgraduate Studies in my university, I've introduced a course. We are the first to start. Research to commercialization. It is a compulsory course for any person that's doing the university. To commercialization. When we do our research like us and dump it on the shelf, it doesn't add value. And when farmers want it cheaply from us, it doesn't make sense. It cannot support me to continue. Who will pay our bill? So we're working with Innovate 8. Perhaps you know Innovate 8. You're way to the airport. The yellow building, that yellow structure, is a technology hub. We've done a curriculum with them to make sure that whatever research we do is researcher from planning, research concept, He's trained to look at values, making sure that he gets patent, commercialize it, goes to the market, and is sold. So that he benefits from his research. After all, she put so much money in it. What happened? Nothing. He only earns her a degree. Doesn't make sense. I hope you understand that. This is where we want to take our country to. So, you are talking about adding urea, right? Ammonia and rice. Yes, that's what we call NPN, non-protein nitrogens. They are essentially required in the rumen of large ruminants. Okay? So when you want to do fast systems, there are other bypass processes I don't want to go into before you say I'm doing classroom again. We mix them in the feed, grind them, out into a cell. It makes the process of having the activity of microbes in the rumen faster. By the way, the reason why fermentation is better than all process, like you said, there is a definition by one of the scholars that it makes every product commercially and financially more and structurally better. I give an example. We all have taste buds, right? When you keep your smoked meat, no, not dry meat, and your wet meat, which one is sweeter? Naturally. Oh, sorry, I shouldn't back the camera. The dry meat is sweeter because what happens is that moisture is what? Removed. The concentrated density, nutrient density is what? Higher. So what happens with fermentation is that it sucks all the nutrients and all the products and converts it into its own body protein. And it is itself available for utilization. Now, my sister is asking about fermentation source. Yeah, you have 101 probiotics in the market today. They are all fermentation products. Manufactured probiotics that are added into the feed. 4-pack extra, many. Different trade names. What they do is that it is an in vitro supply chain into the system of the animal. When they come into the pool, I remember telling the beginning of what we call competitive exclusivity. They increase the value of those those beneficial microbes that are known. For instance, you add phytase in the feed because you want to help. It's an enzymatic activity that helps you break down your soya to release phosphorus, right? So also with the addition of those microbes, our probiotics, it is in a way and the process of adding beneficial microbes into the GIT of the animal so that it can do better. So it's a win-win. So if you ferment all your feed products, each one of them will have different kind of microbes because each plant, each activity, seed, whether it is oil seed or cereal or whatever, have different kinds of, they're either carbohydrate, lignified, non-lignified. They're either, right, or fats and oils. And all of this is kind of feed. Different microbes attack each one of them to convert them. By the way, do you know that microbes can be used in the petroleum industry? That's how bad it is. Good. It absorbs all the pollutants. So that's the benefit of microbes. That is why we don't want antibiotics. So that microbes. And the only way you can do a safeguard is by increasing the population of what? Beneficial microbes. Why are we breaking down our feeds? Why are we doing chopping? Why are we making sure that our feed materials are broken down into pieces? It's to allow for what? Space. Surface area to be increased so that microbes from the saliva, the enzymes begin to work on it all the way to the GIT. And microbes act on it fast. But now, I hope I'm on track. What do we do as a people? Let's talk to ourselves. and build relationships. Let's ask our partners. They have started, like I showed you, where I happen, by God's special grace, been inaugurated as what you call chairman of multi-stakeholders for feed and fodder in Nigeria. The idea is that it was supported by Federal Ministry of Agri, were inaugurated by the minister, and AU, African Union. The Danish government is also supporting us with the fish policy. The whole idea is that we want to look at feed from the value chain approach. Every player that has a role to play will come to the table, from the farmer to the user, from the financier to end user, and looking at every process of the chain and how do we collaborate and have a market-driven model. The only way we can have a sustainable process is when we don't look at it as a government thing. Like you as engineers, sir, what can you do to help us make sure that we can have fermentation as an established process? Or can you create any kind of equipment or machine that help us break down these feed materials into better particles? Or how do we package it? Or how do we remove moisture so that we don't have aflatoxin influence? Those are things that we all have to do. And that's the way forward. I hope I've responded. If there's anything I have not. Thank you so much.
Round of applause for our prof. He has excellently dealt with all the questions and added more answer to the questions that are yet to come. Ma, our director, you have something to say?
Thank you very much. My comment is towards our brother over there that spoke on the use of pesticides and was talking about the place of NAFDAC. Actually, one of my colleagues is supposed to join online, but somehow she has another meeting. But what we want to inform our farmers is that we're having a stakeholders engagement with the farmers and agricultural practitioners. So we're going to share we're going to get your contacts from this group, and then we'll send invitation. It's a virtual meeting. Please join so that you can ask further questions as it concerns NAFDAC with the use of pesticides. Thank you very much.
Thank you so much for that comment. So we are moving gradually to the end of the workshop. It's as if we should not end this workshop again. National coordinator. National coordinator. They are saying that they want 2 more days to the workshop. Is it possible? 2 more days. They are enjoying the workshop. Okay, now I'm coming.
So I want to add something on probiotics. As farmers, probiotics should be at the forefront of your feed when you're producing feed, because what it does is it makes it possible for you to utilize alternative feed materials. Because when you use alternative feed materials or crop residues without using probiotics, those nutrients are locked in those materials and they will not be available to your animals. They won't be able to utilize those crop residues. That is why probiotics are used. I happened to do my undergraduate project on a probiotic, xylanase, because I used rice offal. I substituted some part of my maize with rice offal to reduce cost of the feed, overall cost of production. So please use this opportunity to research further on probiotics or get more information. Prof is here. You can use this opportunity to include him maybe on he's already part of you, to get more information on use of probiotics in livestock production. Thank you.
Thank you so much for the contribution. Do you have any comments from the participants who want to say one or two things before we move to the words of encouragement? But before then, we want to have from each table, what do you have to take home from this workshop? What are the things that have been, well, so many things, but just a take home for everyone. Let's start from here. Thank you.
Good afternoon, everybody. I'm Anne Omonigo Stephen, AFAM Group. What I'm taking home from here, because yesterday I learned a lot how to take care of your feed. And today I'm so happy to hear about the fermentation, what the professor taught us, because to be in this meeting, I'm very grateful. And I won't take it for granted, because I'm going back to feed the people I left behind what I've learned today. So I'm going home full. Thank you.
Is it? What's her name? Dr. Mudashiru, she's online. Just 2-minute comment. She's working. Dr. Mudashiru, we are waiting for you, ma.
I want to say that because I've been online and I've heard the discussion on pesticides, and I was telling my colleague, Mrs. Sarah Jai, who is there, please, I wanted to actually say a few words. And I would like to say that what the agency is doing in terms of registration of pesticides products. As you know, the agency regulates and controls importation, exportation, manufacture, distribution, sales and use of pesticides. And there are a lot of regulatory activities that are centered around pesticides to ensure that farmers out there they get products of good quality, understanding that once you use products of good quality, then you can determine the yield. However, there are issues falsified substandard products that are out there, and I would like to just indulge you all that we're going to be having a stakeholders engagement that is coming up. We're proposing that we're going to have it by October. And I would like, I know maybe you can take Mrs. Ajayi's number so that once we have the link, it's going to be a hybrid, physical and hybrid. For those of you in Lagos, you can join us physically here in our office at Isolo. But for those of you that are in Abuja and far and can't make it, then you can always join us through the link that will be provided with the stakeholders engagement. There are a lot of very brilliant speakers, and there are a lot of discussions that are going to be centered around pesticides, and it's been good for you to ask all your questions and then you'll be answered, because we're going to be bringing in our colleagues from the port inspection, lab, and other relevant areas, enforcement, registration, and so they'll be on ground to be able to entertain some of your questions. Thank you so much, and thank you for the opportunity given to be able to speak with you today. Thank you so much. Thank you, sir.
Thank you, Doctor. Thank you for following us online. We appreciate it. Madam, Doctor, are you still there?
Yes, I'm here, sir.
Please, you have a question.
Good afternoon for the information that you have given to us. But please, I was in a meeting in Foreign Affairs. That was last 2 months ago. You are aware of AGUA. And that AGUA is an organization, an umbrella that promotes exports of all sorts, more especially in the field of agriculture and also in the non-agricultural sector. The meeting took place in other relevant sectors, and it was agreed in that meeting that all this meeting and having some consultations does not actually make meaningful impact. That there is a need for NAFDAC as an agency to have an established platform. It might be a dashboard where a farmer can just go
and peruse all the information that relates to pesticides to be used and the other adulterated herbicides. So a farmer can just go there and a glance, I have just at a glance, I say yes, this particular herbicide has been forbidden. This particular herbicide or insecticide is the one that should be used now by a farmer actually to promote his or her farming activities. That over the years it has been a problem, because I could recall vividly that in 2015 there was a presidential initiative which was domiciled in the presidency. I happened to be in that committee, and it was the time that some of the agricultural produce were rejected. That was the reason why that particular committee was set up, like soya beans and what have you. So that committee came up, and the NAFDAC was also a member of that committee in the presidency. And one of the resolutions was that all the information that concerns all these herbicide products should be published to enable farmers and even the exporters access them, to make everything easier as it were. So I don't know whether you are aware of such information, because there's no way you can reach out to farmers at a go without having a centralized platform or networking that can actually incorporate or disseminate all this information to enable farmers access as at when due.
Doctor, over to you now. Is she there? Hello, doctor. Can you respond to it?
Yes, sir. I think the network was not too good, but I think that from the bit I could gather was that there was a meeting where there were farmers and some representatives of some agencies that were there, and NAFDAC was represented at that meeting. And I think it dwelled on issues of export, I think, and then trying to look at issues of having access to products that are registered. I think that's what he's trying to say. I'm trying to understand.
On platform,
but I want to say that sorry, sir.
On platform. I have access to it on platform, right?
Okay, have access to it.
Yes, to it on a platform, not having one-on-one meeting. That how to reach out to people becomes so difficult. So there was an agreement and a consensus that all this information as it regards to pesticides and herbicides or agrochemicals should be centralized, and also have a platform where a farmer can just go and access all this information from the NAFDAC, portal.
So, sir, we're going to get to it, because initially we had what we call the Green Book. In the Green Book, you had the list of all products that were registered, but we're currently working on that list now, on that book now, because what we have now is we've started it, but we have completed it for the drugs. So we're going to be moving to all the other categories of products where you can also click in and then be able to get this information. And I know that we have in a plans platform, which is also going to be manufacturers. Public will be able to will be able to punch into this NAPAMS and then be able to get it. But I think if you visit our website and you have any issue, you can we have a Q&A segment on our platform in BMAP, and even for the agency, where you can just share whatever products that you have concern on. And remember that we have our offices in all the 6 states and the FCT, so that they will be able to help you confirm the product, the authenticity of the product, and actually confirm if the product is registered or not. And then as for the meeting you attended, I want to believe that my colleague from the exports, that's the PID, will have attended that meeting. And the stakeholders engagement we're going to be having coming up in October, she'll be making a presentation at that meeting. So I would like to request that you please take time out to join that meeting as well, so that I can see that your issues are quite centered around issues of agricultural farming, and then value addition, and then exports. So please, I will indulge you to please take time to join that meeting. Thank you so much.
All right, thank you, Doctor.
They can share my number with you, so that just in case you have other issues, I can also help you too, because the network is really not too good for me.
All right, thank you so much, Doctor. We appreciate you for joining us online. So we'll continue with take home from this table?
Thank you. Thank you
Good
so much,
afternoon.
Mr. Moderator.
Good afternoon, everyone. I want to appreciate this fellowship, Danida Fellowship Center, Danida, anyhow. I know say now they come. So I want to appreciate them dearly because this is an opportunity and eye opener. And the joy of this workshop and training is that it has created an opportunity for we, the Afan FCT chapter. Because I just met Professor Henry. We were together when we were having a seed advocacy group with Pearl. So when I saw the name, I said, "No lie, I know the person. So I have to meet him." And already I have started seeking partnership. And coordinator, I want to appreciate you also. And I want to beg. You know, Afan has chapters in the 36 states of the Federation. So we have 36 chairmen. In FCT, I am the chairman. So I am blessed is me among men. So for that reason, I'm always seeking avenue and opportunity to try that statement that whatever man can do, woman can do it better. So I'm seeking partnership that as we are planning to have our Farmers Day comes 10th and 11th October, we are in the Federal Capital Territory and we are seeing it that is our, can I say, a mandate to usher everybody into World Food Day, which is always marked on the 16th of October. So we want to have our Farmers Day before that date. So we will include to our ask that day that Afan FCT would want to collaborate or partner with any stakeholder, agencies and the rest to establish small feed and food processing industry. I believe as a group, if we start and we have support, we will go better than a single person. And it will be the first for the 6 states what Afan is starting as a project. So I am begging, Daddy, you know, when we were in the seed advocacy group, as a facilitator that I was, is a doctor then, but now a professor. And by the grace of God, before this year runs to an end, I will have my own doctorate also. So, aiming to be the prof. So support me and support all of us Afan FCT. So that they will know that what man can do, women can actually try their best. When we establish that industry, it will be a learning process for everyone. So this fellowship people, no, not prepare. My disturbance will be very high. Because we are going to talk to this Royal Danish Embassy also. So these are Farmers Day coming up. We need assistance to both financially and materially. Our venue, our other things, people can support us also to do it. So my take home one is this, that poultry can be safe for consumption in 5 more weeks depending on what you feed it. You know, the fear is the food. They say the difference is the O and E. The fear is the food. If it is feed right, we consume right. If it is feed wrong, we consume wrong. So I learned that the number of months, days, and years spent is not the best, or not the yardstick of measuring the healthy nature of it, but what it is feed on. So I am going on with that even if I see a chicken of 5 weeks and is very good, well fed with a correct food, I shouldn't be afraid. I appreciate hearing that today. Thank you.
Thank you for that. She said one word, networking. Let us do networking and make it a perfect one for future endeavor. Thank you.
Okay, from our desk, we are saying that opportunities are available. We are taking home that opportunities are available in the feed and further development. Collaboration, partnership, and interfacing is equally available for us at the farmers level. So we thank the organizers, and we are taking home that feed management under livestock production, there are availabilities and farmers can
play their own role as well. Thank you so much.
Good afternoon, everybody. I appreciate the organizer of this workshop. We have learned a lot, and we have known that feed for animal is as much important as food for man or human. So our members who are into livestock will now go home and they reorganize on how to produce feed so that the cost of feed, impact in the livestock production will be less. I thank you so much. And I also know that by the virtue of our participation, we are already Danida Fellowship Alumni. Thank you so much.
Thank you so much. A round of applause for him. Now we're taking the last home before our Vice President Afan will say his.
The opportunity to share my takeaway message here. I would like to say that as an organization, NISEL, that is involved in developing financing frameworks to facilitate finance across the value chain, the agricultural value chain. We have identified business opportunities, especially in the feed and fodder. So in the words of the prop, look around the Abuja environs. There are a lot of garbage that can be converted to fodder and feed. So we'll take that and we'll develop financing frameworks to enable those actors access finance and go into businesses.
A round of applause for him, please. Our Vice President, our Vice Chairman. Vice President.
Yeah. Great farmers, no farmer. I really thank God that I participated in this program to this extent. I saw my friend, my old friend, who we have done a lot of work in All Farmers Association of Nigeria. I want to talk about the organizers of this program. We need more of it, of this type of program. And I believe the people from Denmark or whatever group that is that fellowship, they have done well by providing this avenue to discuss the issue that is at stake. We are talking about food and the other everything pertaining the animal farmers and the cloth farmers, which it is the problem that everybody knows about. There's a trouble that is on the stake. Everybody knows, and the problem is simple. The animals must eat. Likewise, human being must eat. So the stress that is happening is what happened that both animal and animal and crops dealers are the people. They are all feeding all of us. And formerly before, there is what we call if you give me, you take. My father is a farmer. What he did is simple. He usually give out some places to the animal dealers or the herders, and they will use it. After that, they will still go to the other side and do their farming, and you will see the yield is okay and it's organic. But what will actually happen that I learned a lot of lessons which we need to take home is many things. I learned about that we can even get a grant or funding from Denmark or a group of people. Today again, learned about the sustainable feed management and the livestock production. So all these things what we have gotten here, and we are going to take it back and retrain our farmers to get it to the grassroots. Thank you, all of you, and God bless all of you.
Thank you so much, the Vice President Afan. So now, I think, is Sidikat ready? She's online for the word of encouragement. Is she online? Is she ready? See there, she's there. Sidikat, we're waiting for your comment.
Yes, I can hear you.
Okay, yeah.
Thank
you. You can go ahead.
Good afternoon, everyone. Can you hear me? Can you hear me?
We can hear you.
Yeah, good afternoon, everyone. My name is Sidikat Jumoke. I'm a staff of Livestock, and I'm one of the DFC coordinators as well. I'm very happy with the turnout of the farmers and all the participants. We are very grateful that everyone actually learned a lot from this meeting, and we see it more like bridging the gap between the regulators and the stakeholders, because it gives the stakeholders an opportunity to be able to ask their questions to us. And then most of the time when we travel to all these developing countries, we see that actually facilitates trade when the stakeholders can actually interact directly with the regulators. So it makes things much more easier, and it's providing more clarity to the stakeholders as well. So they know what the regulation requirements are, and they are able to stick to it. So this is the beginning of good thing in our food system, and we're thinking more the take home for us. We should try to reduce our own environmental impact. What we are trying to achieve from this meeting basically is, let us have safe water, our environment. We can start by trying to reduce our own carbon footprint as well. Let's have more attitude towards eating more vegetables rather than meat, because we know that there's increase in population, so the demand for agricultural and livestock is increasing more. So we should also try to do our own part in keeping our environment safe. In terms of waste disposal, we can try to sort out our waste. Some of us have actually traveled to these developing countries. We've seen that waste are not disposed just anyhow. There's separation between food waste, cans and stuff like that. We can actually begin with the front of our own house. We'll be shocked that someone can actually see it and learn. Our neighbor sees and be like, oh, this is what this person is doing. It can actually make a little difference and impact in our environment as well. So, and then as far as the antimicrobial resistance is concerned, I'm glad as well that the farmers have actually heard the impact, that it's not just, oh, let's just feed the animal. Basically, what we need to do is ensure biosafety and biosecurity at our farms. It's not just I'm buying animal feed and it has to be laced with antibiotics. Let's ensure that at our farm levels, we actually ensure that those animals are actually safe. Once the animals don't fall sick, why do we even need to use antibiotics in the first place? So let's imbibe and then try to encourage ourselves, and then do more advocacy to others that are not part of this meeting. Let us take this back to them. I have heard a lot of people saying that there are other farmers in other states, and there are other people that were not chance to attend this meeting. So let's start and let's make a difference in our country, and let's try to keep it up, and then probably see you next time, and then let's just keep trying our best, and then we'll get there. Nigeria will be great again. Our system would grow, we would make it, and then through little effort count, and then we're going to do it. Thank you.
Thank you so much.
Bye.
Thank you for your words. We really appreciate. I want to thank everyone. We are coming to the end of the workshop. We want to thank everyone for your patience, for attending and contributing words or quota to this workshop to make it a success. We really appreciate everyone. So now I'll be handing over the national coordinator for the vote of thanks and the closing. Thank you.
Hey, farmers, great farmers, I'm so overwhelmed that our little effort is being impacted, that people are learning, and that people are willing to learn. You know, change is what is constant, but most of the time we fight change. You know, we've been talking about food. Food is not food though if it's not safe. And any food that have chemical residues, any food that will cause problem is not food. It's considered as poison. So we should be careful. In everything we are trying to do here is to reorientate us in our mindset. Not just to talk about having food on the table, but having nutritious food in the right way, which is healthy, which all of us will enjoy. I want also, you know, many people have said, I want to be part of this. I want to be part of this. Even the people that requested that we continue. Thank God that you are enjoying it. And I know as this thing is being recorded, we'll still upload it to the people who sent us. The Denmark people, the Royal Danish, and the Danida Fellowship. They are the one who will still call you back. Thank God we all wrote our names. I hope you put your email. Because if you have your email, you will get the presentations. But when you don't have your email, you will learn from another person. You know, we had printer for language. We have in Hausa, we have in Igbo, we have in Yoruba. I don't know, people who are leaders can take it. And if you can understand it better, you can use it to teach others. I want to thank each and every one of you. And I pray that you take your lunch. And you will be nourished. And when next we call, please answer us. We are thinking of forming a forum, maybe a WhatsApp group, where all of us will be there. Where you can ask your questions while we are waiting for another training. Because good soup, I was waiting for that. Now money kilamo, the LED, the live streaming, the decoration, the hall is not free. It's paid for. And when we get another fund, we will do the needful. But while it lasts, please let us all be a extension of the Danida Fellowship wherever we find ourselves by doing the right thing. Thank you, thank you, thank you. And when you have your meal, if you have anything to tell us, our numbers are here. Thank you, my brother, for helping us to bring your people. Please accept us the way we are. Where we didn't do well, I pray we do well next time. And where we did well, we'll do better. God bless each and every one of us. So as you take your meal, you can conveniently eat your food here, or you can take it home. Thank you.
Hello, thank you for giving me the opportunity. I believe we've all gained something useful. Anything we gain from here, let's apply it when you get to our various destinations. By grace of God, in Nigeria, we are going to have food sufficiency. Food insecurity is going to be ended. Sustainability will continue. And through this, we've learned here, we can know that
practicing feed and fodder management is a good way to go about. When we manage it properly, we will benefit from it. Our livestock will benefit. Likewise, in return, we come back to the human being. I wish you safe trip back home. Till another time, you are all welcome. Thank you.
Madam, coordinator.
Get your mail. Thank you so much.